and rule is still in effect, both inside the county building and inside these chambers. So if you're going to remain in the chamber, please wear your mask and cover both your face and your nose. Unless it's necessary to speak into the microphone, you can remove it. And also, we're all cognizant and aware of events that have occurred both in Washington, D.C. and throughout the United States that have the tendency of putting both the elected officials in danger along with other people that are in that facility should there be some sort of riot. And so we're taking extra precautions to protect the integrity of this chamber and our ability to do the people's work unimpeded and in a safe manner. And so the deputies and security officers are here to ensure our protection and your protection and safety as we do the very important work of local government. We thank them for being here today, and I thank everybody in advance for your decorum and civility as we handle many important issues today that are on the agenda. We'll start with agenda item 1A, roll call. Will the clerk please call the roll?
Commissioner Bernard,
Here.
Mayor Kerner,
Here.
Commissioner Marino,
Here.
Commissioner McKinley,
Here.
Commissioner Sacks, Vice Mayor Weinroth,
Here.
Commissioner Weiss.
Here.
Thank you.
Very good. We do have a quorum with 7 county commissioners present. I'll now recognize for agenda item 1B and C, Commissioner Maria Marino to lead us in the Pledge of Allegiance and the invocation. Please rise.
Please bow your heads with me. Let us pray silently together, each one of us according to our beliefs. Let us offer thanks and the blessing of fellowship around us. Let us be a source of hope for those in need. Let the feelings of love, kindness, and a well-directed yet gentle spirit always be reflected in our actions. And as my mom always says, let us leave the world a better place than we found it. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Marino. We'll turn now to agenda item 2A, additions, deletions, and substitutions to the agenda. Madam County Administrator, you're recognized.
Good morning, Mayor, members of the board. This morning, the only change is the deletion, page 39, 3EE2, and that's deleted for further staff review.
Very good. That item does appear on the consent agenda and will be removed if adopted by the board. So we'll now take any motions to adopt the agenda as amended.
Move to approve the agenda as amended.
Second.
A motion by Vice Mayor Weinroth and seconded by Commissioner Bernard to adopt the agenda as amended. All in favor? All opposed? The agenda is amended and adopted 7-0. We'll move now to the consent agenda, agenda item 3. If there's a member of the public that would like to speak on any item on the consent agenda, please submit a card to county staff and we'll make sure to recognize you. And we'll start with my colleagues on the board. Are there any items that would like to be pulled from the consent agenda? Very good. Commissioner Bernard, you recognize, sir.
Thank you, Mr. Mayor. We do have one public speaking card for item 3EE1 on the consent agenda, which is going to be Lindy Harvey.
Good morning. Can you hear me with my mask on? Okay, I'll talk as loud as I can. Thank you very much for letting me speak, and thank you for letting me be in the chambers this morning. My name is Lindy Harvey. I'm the Executive Director of the Spirit of Giving. We are a collaborative partner with the county and the Office of Community Revitalization for the Back to School PBC. And last year was our first year being a major partner with the county, and it was, even through COVID, it was a wonderful experience. We were able to distribute over 10,000 backpacks to the children in our area who need it the most. We did it. Not only did we do it because of COVID, we had to change it because of COVID and make it a drive-through event, but then we got hurdled with a hurricane warning too. So it was a challenging thing, but we were We looked at the full picture, and we knew that the children in our county needed these supplies to be able to start the school year, whether in person or virtually, with those tools they need to succeed, and that's what we accomplished. And we had so many great partners that helped us get food out to these families too, and shoes and socks, and we were thrilled to be a part of it last year and looking forward to being a part of it again this year.
Very good. Thank you for your comments here today. I'll recognize the Vice Mayor.
Thank you.
Thank you, Mayor. And Ms. Harvey, I'm glad you came to speak this morning, because I was going to also bring this forward and let people know that Spirit of Giving is certainly a partner in Boca Raton and throughout the county. What you've done for the school children these years with the backpack program is terrific, and what you've done to help children come out and see the Boca Raton Bowl over the last few seasons has been terrific. So thank you so much for what your organization does.
Thank you for all of your support.
Very good. I don't see other comments from members of the board, so I'll just extend my thanks and sincere gratitude on behalf of the board, as did the Vice Mayor, and keep up the great work. I'm confident that children will be excited to go back to school.
Thank you again,
More
and
so
thank
than
you so much
most
for
years.
all of your support.
Absolutely.
Mr. Mayor, I'm going to move the consent agenda.
Very good. The Vice Mayor, Weinroth, has moved the consent agenda forward for passage. It's been seconded by Commissioner Greg Weiss. There's no further comments by members of the board. All in favor? All opposed? The consent agenda passes 7-0. We'll move now to agenda item 4, special presentations, and we're delighted to be joined today with Dr. Alina Lonzo and Mr. Bill Johnson, our emergency manager. Oh, I apologize. We'll do United Way first, right? Okay. Come on down. I had a premonition. Yes, ma'am.
Well, good morning. Thank you, County Mayor, and to all the commissioners, good morning. It seems like I'm seeing you way, way too often. Good morning, County Administrator, Ms. Baker. How are you doing? Thank you very much for having me here again today. I'm going to go and give a quick update in terms of our numbers, like we usually do. And in addition to that, what I really want to concentrate is on talking about the vaccine and let you know how we're proceeding in this. We've given several presentations to various groups around town, and this is an ever-changing and moving situation. Just real quickly, let's start with some of our data. We know that the cases, everybody's been hearing all the news about the cases that are going on across the country. A lot of very serious hospitals in trouble, and the cases continue to go up. We continue to be #1 in the world in terms of cases, with 22 million cases. Our next country as close to us is India, followed by Brazil. In terms of the states with the highest numbers, is California, Texas, and Florida is #3. And the cities, Los Angeles has 920,000 cases, followed by Cook County, Illinois, 419,000 cases. Then Maricopa, Arizona, with 300,000. And then we're #4 in Florida with the 328,000 that we have. Miami-Dade, obviously the highest number in the state of Florida. So that's just to give us a perspective of where we're lying. This was the chart that we saw last time with that high peak back in December, and then we followed it by now a new spike on the 2nd with over 302,000. So that's the highest that we've had. We passed the 300. So we kind of were feeling that maybe the curve was coming down a little bit, and we had that huge spike. We've had another close in the 292,000 on the following day, so we're not sure that this curve has begun to go down yet. These are our numbers for Florida and Palm Beach County. We have 1,488,556 cases in Florida. We're having about 11,576. We're in that range of cases, new cases per day. The total patients hospitalized in Florida is 65,796, approximately 200 cases, new cases per day. And the deaths that have been reported have climbed somewhat. We're at 23,071 for the state. We had an additional 159 cases reported in the last report. In Palm Beach County, our numbers pretty much as predicted, unfortunately, that now in January we're seeing thousands coming in per day, 92,542, so our last count was 831. It's a little more comfortable when we keep it under 1,000 for our contact tracers, but they're doing quite a job trying to get this done. We've had 11 new hospitalizations, bringing the total to 5,252, and 17 deaths reported. For many days, you saw that we only had 0, 1, 2, so those number of deaths will get put into different days. We have 1,972. This is our board that we look at. As you can see, the hospitalizations are staying in the total beds around 76.6%. They have climbed, they're above the 75. We want to keep 25% of our beds empty. However, the number of COVID beds in the hospital is staying at around 8%. The ICU beds are at 69.5%, so they have not gone over the 75, but the percentage of the people in the COVID beds in the ICU has gone up. It's now 26%. So over a quarter of the cases in the ICU are COVID patients. The ventilator remains within good range. We have not had ever problems with the ventilators. Our new cases per day, as you can see, the highest that we had was on New Year's Eve, where we had 1,256. That's that number. I'm on Bill's head instead of on the board. Anyway, the number on 12/31, we had 1,256. We've had a couple of thousands on January 7th and the 6th, and then we took a little break, went down to 600, and our last number was 819. The daily positivity has remained quite high. We actually had one day on December 28th that it rose to 20, but maybe that was just a fluke, but it has remained high, way above the 5% that we need to do good contact tracing. So our contact tracers are struggling. We have had several resignations and several people that we had to let go because they couldn't keep up with the work, and so we're better off having fewer good workers that can work efficiently versus just the numbers. So we're struggling, but we're keeping up with the numbers. That's what counts. Our daily positivity rate is, as you can compare it to the state, we're below the state. We're at 8.85. The state is at 10.60, and Broward and Dade are very close to us, but we're still doing better. The total positivity has definitely gone up quite high. We are below the state, and we're just about in the same range with Broward, and Dade's a little bit higher. So those numbers will probably continue to go up. The census tracts, now you can't really appreciate it on this slide that I have to the right, but the colors we actually had to add another color for 65 plus to 75 because of the increasing in numbers. So this was back at the beginning of December, where we had these colors, and as you can see, it's getting darker. So we're having more cases per week, almost in all our zip codes. And especially the zip code out in west between Delray and Boynton, just west of 441. This area has remained with very high numbers all along. There's no contact tracing information that would give me any outbreaks or anything like that in that area, but it just has remained very high. So maybe we want to do talk with the municipalities and see if we can get any sense of anything different that's going on there. But so far, we haven't found any connection. So the executive order, we want to make sure that everybody understands that in that executive order, the governor basically said that we would vaccinate only the following populations: long-term care facilities, the residents and the staff, persons 65 years of age and older, and healthcare personnel. The issue here is that a lot of people want to get vaccinated because they have comorbidities. We cannot do that based on the executive order. It only says 65 and older. So for that reason, that's also one of the reasons that we have such a high volume of seniors all rushing to get vaccinated. Usually in the first phase, we'll talk about the controls that we have. And so that is the way the executive order. So when people want to get ahead of someone else because they have comorbidities, by the executive order, we cannot give that priority. The only one that has that privilege to do that, that discretion, is at the hospital when they're doing the patients. The doctor has the discretion to do that in the hospital. So our 3 phases that we have been talking about in several different meetings are very important. I want to go through that a little bit so everybody understands what we're saying with this and what it means. In phase 1, and this is true for every production of vaccine that has ever occurred, this is not specific to COVID. In phase 1, there is limited vaccine available to the communities because it's just being produced. In phase 2 is when you start have fluctuating vaccine, that the vaccine becomes more available. And it's not until phase 3 where you have sufficient vaccine. That's when you start vaccinating your general population. The time between phase 1 and phase 3 is several months. So if we start here, we started at the end of December, we will probably not get to phase 2 until sometime February through March. People have to understand that. And we won't get into phase 3 until early spring or the summer, which is why early on when you heard the conversations about when will the general population, the conversation was always the general population would get vaccinated sometime in the spring to early summer, right? So that is based on these phases that we know that every vaccine goes through. Now, what happens then here in Palm Beach County? So what we have been given based on the state designated priorities is to vaccinate the long-term care facilities and the residents and the staff, the frontline healthcare workers, and the people 65 of age and older. That is what we're doing in phase 1. And the difficulty is trying to get that 400,000 population of the 65 and older vaccinated at a time where we have very limited vaccine. Now, it's not a conspiracy and it's not anything extraordinary. The vaccine is simply not flowing to Florida. So we get the vaccine, we're getting very little amounts, and despite those little amounts, Palm Beach County now is number 3 in terms of vaccination. Okay, we're at 42,000 vaccines, followed by Broward with about 50,000 and Dade 68,000. I wrote it down, but the point is that despite us being the last county in terms of when it started giving out the vaccine, we were the last one to receive it, we have actually past many of the other counties that started earlier. So we are vaccinating quite a few people every single day. But for that person that's waiting for that vaccine who's 65 and older, it seems like we're not doing anything. And we totally understand that. Everybody understands that. So we're asking for help in one of the things that's very important to do in this first phase is the messaging that we need to realize that there's a shortage of vaccines. So it's not the plan, it's not our ability to do it, it's simply supply and demand at this point. So these are the groups that are being tested in Palm Beach County. We all know that the hospitals and the care workers are receiving the deliveries from Moderna. These vaccines are being shipped directly to the hospitals, and they have the discretion, like I said, to vaccinate vulnerable patients. This is not being done by the health department. These shipments are coming directly from the state, directly to the hospitals. The nursing homes and the long-term care facilities was a contract with CVS and Walgreens exclusive. We have now brought in 2 strike teams that will remain in Broward and Pinellas to assist the long-term care facilities there, and they're going to bring a strike team to do the CVS vaccination that was being done by CVS to the assisted living facilities, while the others continue to do the higher skilled facilities. So there's going to be a split to help speed up that vaccination here in Palm Beach County. The fire rescue, the paramedics, the healthcare district frontline, the healthcare workers, that's being done by the health department. That's where we are distributing the vaccine to our partners and, of course, vaccinating the seniors, 65 and plus. That's where we're distributing the vaccine that's coming through the health department, and now we're also distributing vaccine directly to the healthcare district. So those allocations are coming in daily. We split them up, and we are out there vaccinating. These are some of the steps that would be taking place in Palm Beach County. The objective is, I as the director, my objective is to have equitable distribution of the vaccine to all the residents and visitors who want to be vaccinated in Palm Beach County. And I tell everyone that there will be plenty of vaccine for everybody who wants a vaccine to get one. It's just going to take time. It's going to take weeks, months to do that. It's not going to take days. In the era of instant delivery, 24-hour delivery for everything that we want, it is very hard to satisfy that expectation that it's not going to be done in 24 hours. It just cannot be. It's supply and demand. We have vaccinated all the fire rescue, all the ones here. The only ones left are the healthcare workers and seniors. So we're allocating vaccine for that, and that's who we're vaccinating right now. It's very important to get a messaging and making sure that everybody that goes for a vaccine has an appointment. Please, the public, do not show up at a site without an appointment. You will not be seen. We do not want the lines that we saw in Duval, Lee County, Pinellas, and other counties where they had seniors sitting in line in wheelchairs and in cots waiting overnight to get an appointment. We don't want that. So you have to have an appointment. You have to be registered. You have to have a consent form. You have to read it. You have to consult with your physician in terms of getting the vaccine. This is not a swab in the nose. This is not like a test. This is a vaccine that you're getting, and it's very important that this be done. So please, everyone understand you have to have an appointment. The second messaging is to eliminate that unrealistic expectation due to the limited vaccine. Right now in Palm Beach County, we're getting 4,000 doses per week. And we have 100,000 people seniors that have signed up to get the vaccine. So if you do the math, you realize there's no possible way that this is going to be done in a week or even a month. This is going to take time. In phase 2, once we start getting more vaccine, we'll be increasing and augmenting and ready to increase to do the mass volume vaccination centers. We have mobile units, we have large-scale community pods, and continue to work with those groups in Phase 1 and any other groups that are added through the governor or through executive order for Phase 2. And then Phase 3 starts then the mass vaccinations, and then you open up, you still have the same apparatus to do it, but you open it up to the general population. Now, I can tell you right now that in Phase 1, we already have the mobile unit. It's going out. We will have much more ability to vaccinate and do much more. And so that's the cry that we've been asking, that Palm Beach County has the capacity to compete with both Broward and Dade. We have the staff, we have the knowledge, and we have the ability to go large scale, but we need vaccine. So the fact that the healthcare district now has gotten some allotment on there for them is going to tremendously help us, and they're already going out and already vaccinating, and that's going to help us quite a bit. We're probably going to pass Broward. I don't know. We're very competitive, so we're always competing. So new developments. The governor traveled to Ocala a few days ago, and he added Publix. So when this announcement came out, everybody rushed to Publix. It's only in 3 counties, Citrus, Hernando, and Marion. They have a population together, the 3 counties, of over 200,000 senior citizens, based on the percentages that are in each one of these counties. They are rolling this out to 22 different Publix in these counties, but they only got 15,000 vaccines. Okay, so we're in the same boat. We're getting 4,000 vaccines per week for over 400 people. 400,000 people, what am I talking about? 400,000. And not every one of those 400,000 people obviously are going to get the vaccine, but we do have 100,000 that definitely want it already. So that's the issue. Then after that, he also, the governor also is going to do some sponsored churches, state-sponsored churches. And what I mean by that is that there's going to be strike teams that are come down to specific churches. Please don't ask me how those churches are being picked. I have no idea. I don't have time, nor am I in the chain of command to talk to the governor. I don't know. My job right now is to get the vaccine and distribute it, and that's what I'm spending the whole time on doing. I don't get into the politics of this, and I don't talk to people to get things. I talk to my health department and up through the state. That's where my conversation goes. I am vocal. I think everybody knows that. And I do ask for Palm Beach County, and I advocate for Palm Beach County, but I don't have the ability to go to places that people want me to go. Some problems that we've had, very big problems. The statewide telephone system was not capable of handling the high demand. We've done here in Palm Beach County is we've added additional lines to our local phone system, and we're using volunteers to augment the present staff. The COVID money that was available before is not available to us anymore, so I do not have the ability to hire or do any contracts right now, but we're still looking to see if we can put some things together in terms of handling more volume. We know how important the telephone is, and that not everybody has the ability to go online and switch to the web-based system that we have right now. We did create a web-based scheduling system. It was tested at another county, and it crashed. It does not handle the high volume. That was one of the solutions that we had within our system. The other difficulty in trying to just go out and get a vendor is that everything is tied into our state system, and there's security issues and other things that have to be overcome technically that doesn't give us a lot of flexibility. So we're left then with a email box that we created. So our solution to that, we switched over to an email box to capture the residents wanting vaccination. So what we've asked them is to go to the, it's CHD50 feedback at flhealth.gov. And that email site is on our website. It's been announced in many, many different areas. And we ask them to put in their name, their date of birth, their address, and their telephone number. One of the problems that we've had is that everyone sending in those emails have not filled in all the required fields. People are re-entering the emails, hoping that if they put in 10 times that they have a better chance of getting picked. That is not correct. This isn't a lottery. It just clogs up the system when you do that. Also, there's a confirmation return, but that confirmation return fails if there's more than 30,000 emails at a time coming in. So some people are not getting confirmations. We have assured everybody that has called and that is asking that your email is there. You do not have to get the confirmation in order for the email to go in. The good thing is that it will leave people in queue, and so we'll have a stamp date of when people asked for the vaccine, and that way we can take them in queue. The other problem is an extremely high level of anxiety and the expectations. So today we will do a blast email explaining that the emails have been received to every one of the 100,000+ people that have emailed us, so that they know that they have been heard, explaining that it's going to take weeks and months, not days, and to listen for further communication and announcements about testing locations that are coming to their areas, and a web-based appointment system that will be created to actually go into the vaccination pods when they are set up. So we're going to use that list that we have with all those hundreds of thousands of people to communicate with them via that email. For people that don't have an email, we have been working with them to either get a friend who has an email or someone that can help them if they have an email, or someone else, they can use someone else's email that they have confidence in, and we can set it up that way. If everything else fails, and we will continue to help them to make sure that they get in there. But that's what we have right now, and that's what we're hoping to continue to work on. And again, use that large database for both the demographics as well as communicating back with them. So until then, and even with the vaccine, it is very important that we continue our practices of wearing our mask, washing our hands, sanitizing touch surfaces, and of course, getting vaccinated as soon as we can. Avoiding the 3 C's, stay away from crowded spaces, closed-in spots, and wherever you see crowds gathering, and especially if they're all walking down the street without masks, stay away from there. Many of the citizens that I have been talking to, that I've been privileged to talk to in the last weeks actually, they all tell us the same story. They haven't been out in 10 months. One person came to our vaccination site and said he was scared to death. He had not been out in 10 months, and all of a sudden he shows up in this room where there's 50 people. We have, all the testing sites have been distancing and trying to keep people away from each other. I imagine there may have been some glitches in terms of lining up and people rushing, but each site that is set up with the appointments, we're scheduling the time. We also have to have seats for them to wait for 15 minutes after they get the vaccine. Those seats have to be apart, and that is some of the limiting factors in terms of our vaccination. We have to have enough seats for them to wait. So that is part of what is calculated in your put-through, both fire rescue as well as all our folks that are vaccinating. That's a major contributing factor that has to be put into there. But that's all for your safety and to make sure that people do feel safe. We have had tons of kudos, and they're very happy when they get their vaccine. The big issue that people are angry is not being able to get that appointment. So we're working on it. I know that if you're in line, that doesn't do you any good to hear that, but we need to know that we can only give as much vaccine as what we get. We continue to ask for more, and I hope that this helps some of these questions. I'll be up for any questions that you may have. I'll be glad to answer.
Thank you, Dr. Alonso, for the update. We'll start with Vice Mayor Weinroth and then move to Commissioner McKinley.
Thank you, Dr. Alonso. And certainly, as the face of the Florida Department of Health, you certainly are on the hot seat right now.
No problem.
I thank you for, again, collaborating with the county. We, as a body here, appreciate the fact that you continually have come in here to update us and give us this information. And I know our stakeholders who are watching today and the news that's going to be reported during the day is going to be helpful as people are trying to figure out what's going on. One of the, and I've got to tell you from my email, I think there are more than 100,000 people waiting for this vaccine. One of the real issues out there is, and you've touched upon it, is the issue of equity and transparency. You know, I think that our residents are willing to wait if they know that there's a fairness to this and what's occurring, and I think that there's a concern. And a lot of my constituents are saying, when they ask me, well, why is someone from Georgia here getting a vaccine, or why is someone from Broward getting a vaccine? And I said, because the governor said we cannot discriminate by residents, that anybody who gets an appointment is entitled to get a vaccine. The problem is they're saying that they're calling down to Miami, they're calling down to Broward, they're calling St. Lucie, and as soon as they give them an address, they say, sorry, you can't get inoculated here. So my question is, why is it that we are taking everybody from Canada down to Texas, and Miami-Dade and Broward and St. Lucie are being a little more discriminatory?
My sons and my staff ask me that question all the time, and my answer is, we're following the rules. Palm Beach County follows the rules. Now, that does not mean that every single person in Palm Beach County is following the rules. We know that people have done things they shouldn't do. If something is being done that shouldn't be done, it needs to be reported. Especially, you cannot charge for this vaccine. It's a federal vaccine that you're getting, and you can't charge. The only thing you can charge is you can charge the person's insurance a $15 administrative fee. So that is very important. I don't want people getting ripped off out there, and that should be reported right away. The inequities in terms of trying to distribute this throughout the county and not just in one area and so forth, we're trying to do that very hard. But I guarantee you that no matter how hard we try, somebody that's not getting it is not going to feel that it's fair. And I remind people that equity is not fairness. There's a big difference. Equity does not mean equal. Equity means that you are trying to take care of the underserved and the different geographic areas and the different demographics to give everybody in the community an equal chance to have access to the vaccine. And that doesn't mean it's equal, and it doesn't mean it's fair. I mean, just do the math. We can't possibly be everywhere at one time. So that's my answer, that we are following the rules, and that's the way. It's pretty clear that, now, I will tell you that people are also going from here to other places. So they're going to Gainesville, they're going to different places, and they're also going outside of Florida. So we're going to have a lot of people coming down, and the word gets out, and if we do a good job here in Palm Beach County, I bet a lot of people are going to come here because they know we do a good job.
And I'm assuming that we'll have less people coming here from other states now that the CDC has changed their guidelines to put 65 and over into the priority like Florida had already done. So hopefully they'll stay in their states and not come down. They can come
Hopefully.
down to be tourists, but not necessarily pick up vaccine. Let me touch back on what you had mentioned before about the people who are emailing you, and some of them saying, I'm not getting any response, I'm not getting an acknowledgement, I don't know if they have my email, and as you said, this is resulting in people sending emails probably, dozens of times. Can you please repeat what you said as far as the acknowledgements that you're going to send out now?
when you send out that email on that site, CHD50 feedback at floridahealth.gov, and it's FL, not the whole word. Look at it, it's on our website, and make sure you type it in correctly. If you get an error in the delivery, then you didn't send it out correctly, and that is a mistake, usually because you've put a space or you've put a wrong letter in the email address. If the email goes through, we will have received it. We have literally checked on hundreds and hundreds and hundreds of people, and in every case, their email is there. We had over 56% duplicated cases in the emails that were sent in. People either putting them in multiple times or just checking. Even the reporters were doing that. They were checking to see if they were getting the response. So that automatically, so please don't do that. It ties up the system. You're putting in your names. It's not a lottery where, you know, the more tickets you put in, the more chances you have. So we have checked, and I can tell you, if your email goes through, you are getting the appointments in there, and you'll be in queue. And that's important so that we take people in the order that they came in.
Thank you. I'm just going to repeat that email again, just in case anybody has not heard it. It's chd50feedback@flhealth.gov. And so they should get some sort of acknowledgement from the Florida Department of Health to let them know that that has been received.
So we're going to periodically now use that list and blast email to them communications so that they know that we're in communication with them. I think that's going to help.
My final question before I yield to Commissioner McKinley. Those 42,000 who have received the vaccination, they're going to have to get a second vaccination. How do they know when and where to get their second or their booster, and how is that going to be handled?
Right now, most people, we're giving them appointments, we're calling them and reminding them. The Florida Shot System has a reminder, and so that will be utilized, and we will call them probably multiple times to make sure that they know where to go, that they remember the date, and we will help them do that. So those are telephone calls that we're actually making.
So they shouldn't just return 28 days later to the place where they got their vaccination?
They would rather they not do that, because when we set up the date, it may be, for example, if you did it and it falls on a Sunday, we're not going to be open. So it's better that you confirm that date, and we will confirm the date with you to know to come and to what address.
Thank you, Doctor, and again, thank you for, again, collaborating with us, because it's been very helpful as we've tried to address these concerns with our stakeholders.
We'll keep working on it.
Thank you, Vice Mayor. We'll now go to Commissioner McKinley and then to Commissioner Marino.
Dr. Alonso, let's start with technology first.
Okay.
We are the third largest state in the country with over 21 million people. Our economy is bigger than most nations around the globe. I've got 500,000 acres in ag production. Those farmers can tell me exactly when a seed was planted, what kind of seed it was, and where it was planted, any time of the day, 24 hours a day, 7 days a week. And we can't figure out how to do an auto response.
A what?
An auto response, so that when somebody sends an email, they get an automatic, the legislature uses this all the time. Thank you so much for contacting my office. I have received your message. We can't figure it, the legislature can figure it out. We can't.
We figure it out. It has it. However, the system that we have, whether it's old or lack of updating due to budgets or whatever other reasons, probably a million other excuses, doesn't help anybody for the excuses, but the system crashes when it has it doesn't crash, I'm sorry. It doesn't give an auto response once it receives 300 emails at a time. It stops giving auto responses. That's at the state level. It's the system that we have. So I agree that it seems impossible, just like it seems impossible that you have to wait when we can get a delivery from Amazon in 24 hours, that we can't get faster deliveries. I agree with you 100%, but that's the system that we have.
Can we go over those numbers again? Because on our press conference last week, we told the public that the system shuts down after 10,000. Is it 10,000, is it 30,000, or is it 300? I've heard three numbers.
Well, now I'm going to have to check, since you gave me that. I'll have to check that number.
Okay, and is it the department staff, the agency staff in Tallahassee that's handling this type of procurement, or are we actually, has this been elevated yet to Jamie Grant's office, who's the Chief Technology Officer for the state of Florida? Who's handling these technology decisions?
The technology, when we can't fix something locally, when we look at it and we don't have access to it, we send a ticket to the Information Technology Office up in Tallahassee, and depending on the level of it, and depending on what it is and what they analyze, it goes to different people. So the name that you gave, I don't know that name. I give that to the IT manager, and he handles that up through the state. The answer came back that it's a system issue, not a local Palm Beach County issue.
Okay, before I go on with further comments, Ms. Baker, can we have our Legislative Affairs Office make contact with Jamie Grant's office today and find out how high up that's been elevated, because this seems to me an urgent matter. One of the things that concerns me is security. I can tell you, and I'm sure my colleagues up here who've run for office can tell you, that when you get ready to file your campaign, one of the first things you do is you go up and you go to GoDaddy or somewhere else and you buy up the websites that would be similar to yours. For me, everybody always spells my last name incorrectly, and so I had to set up email accounts that had my last name spelled incorrectly, and they were rerouted to the correct email address. My concern is we've got CHD, which I assume stands for County Health Department. So CHD 50 feedback at flhealth.org or .gov. .gov. My concern is you've got some fraudsters out there that might be setting up very, very similar emails, and people are sending personal information, identifiable information. Has anybody looked into, I assume you've got a technology team that can figure out what some of the errors might be in typing in that email address and setting up those email accounts to receive them and reroute them to the correct one, if we're not sending an auto response.
I understand the question you're asking me, but I don't have the technical information to answer that for you. I would have to talk with those people up in Tallahassee and check that. That's not something we do at the local level. That's
Okay.
completely dependent on our state system.
And then every county has been charged with setting up, every Florida Department of Health regional office in each county has been charged with setting up their own email addresses, correct?
What do you mean by that? I don't,
Your staff determined what your email address was going to be locally, or did Tallahassee determine that?
it's determined through Tallahassee, through our HR. There's a certain system that's used with our names that's utilized.
Okay, doesn't seem to be any rhyme or reason, because Leon County's is much different than ours, and I think ours is actually easier. But why?
What do you mean Leon County has a different email system? They have the
Yeah,
same
they're
one?
like Leon, CHD, something.
No,
feedback.
not the official state emails are all the same.
Okay,
When you
that's
go
not-
on the website, we have it where you can search it with Palm Beach County Health Department, because that's what people still call it, instead of Department of Health. So it's what you talk about, that it will go ahead and search for that website.
Okay, well, I saw our legislator post the Leon County email address yesterday, and it was a much different format than what ours is. But I also, I saw that Representative Chip LaMarca down in Broward County, he posted a phone number that you could call in Broward County to arrange an appointment. So why is it some counties have a phone number and some counties do not?
Because they're not doing it through the health department,
Okay, who are they doing it through?
through Broward Health System.
Do we have any phone number accessible appointment scheduling in Palm Beach County?
Yes, we have our telephone number that's for appointments that's been used. I don't have that memorized.
So, I'm getting more confused as I ask questions. Do you have to send an email, or is there a phone number you can call?
We prefer that you send an email, so one, it can be logged. Two, we have a record of it. When they make the phone call and we get thousands of calls, they're going to be on hold. People don't like being on hold. So the email is much more efficient, and it gives us, if they fill in all the information, it gives us a lot of data to be able to have access to them and to be able to send them to locations that are close to them once we start opening up more locations. So it serves more than one purpose. It also serves the purpose of us being able to get back to them with information. So that's why we prefer the email system. If they call, there's going to be waits, and depending on the volume, they're going to be waiting for a long period of time. All the phone systems that we have developed, from testing through everything else, none of them are good. People are always complaining that they're waiting too long. So the phone systems, no matter where you are, even in Broward, get overwhelmed. They filled up their appointments all the way through February. So right now, you can't get an appointment until after February. So it depends on what you use and who's using it. So the phone system, yes, is available. You could probably call now and see if you can get through. I just did a bad thing. There's going to be 1,000 calls right now. They're going to kill me. But the email, we believe, is much better.
And your employees are answering those emails and answering those phone lines, the state employees.
Yes.
If somebody is interested in volunteering, how would they go about that?
We have a volunteer coordinator, and they're taking volunteers, and the medical society is also taking volunteers. We have lots of people that want to volunteer, nurses, doctors, and we're utilizing volunteers.
Okay, let me go to the next area of questioning I have, and that's on priority. I get several emails a day, as I'm sure we all do. I'm a teacher, I'm a frontline worker, I work in a grocery store. I should be a priority. I'm an essential employee. Right now, who is determining exactly what group of people are priorities?
It's an order by the governor as an executive order, and it's only those 3 people that we put up on that slide.
Okay, I think that's really important for people to understand that the county commission has no authority to prioritize any group of the population right now. That's all coming from the governor. And his priorities are actually a little bit different than the CDC's priorities, correct?
There's a difference that, especially in that first phase, it's good to limit the groups so that, for example, if we had picked 85 and older in the beginning and then gradually opened it up, that would give us a smaller window and we wouldn't have this 400,000 people calling in, right? So that's how you handle that first phase, is trying to limit the groups that you selected. So we originally selected fire rescue, healthcare workers, and then we were going to expand it to law enforcement. Well, law enforcement has been taken out of the picture completely because they're not providing direct care, whereas fire rescue is vaccinating. So that's part of the fact that we added that 65 has overstretched our capacity to vaccinate because of the limited vaccine.
Wow. Okay, I would argue that there are some law enforcement agencies in Palm Beach County that have the ability to provide direct care. There are some law enforcement agencies that are carrying Narcan in their vehicles, and with the overdose numbers up 26% over last year, they are providing that direct care. Perhaps, Mayor Kerner, that's something your office could make sure that the governor understands.
For the offices that are providing direct care in terms of the medical staff, they can get vaccinated.
No, this is the entire road patrol. That's the entire force
Oh, okay.
carries Narcan in their vehicles.
I understand.
Next, on distribution, so on Friday at our press conference, it was 24,500 vaccines that the county had received. In my my review yesterday, we were told that another 4,000 was on the way. I don't know if they were received last night.
We received it yesterday around noon,
Okay.
4,000 for us and 4,000 for the healthcare district.
So you've received 28,500 vaccines, but overall, through various agencies, the county's received 42,000?
I have a whole list of, and remember, there's also vaccines that have been received by the hospitals, vaccines that have been received through the direct shipment of CVS and Walgreens. I do not have eyes to those, and I don't have information from the hospital vaccines. So there's several groups that we don't have access, and we don't know if they're being reported or not in the count. It looks like the count that we are seeing in terms of the 42,000 that we vaccinated is actually the Florida Shots information. So our vaccines and the vaccines that we're giving out.
So 42,000 is the number of people that have been vaccinated, but 28,500 is the number of vaccines that the Florida Department of Health in Palm Beach County has
Yes.
received. Okay. On that distribution, where is Century Village and Kings Point and those gated communities, where are they receiving their vaccines from?
The state is sending down for those strike teams, which is why we requested strike teams, because we knew we wouldn't be able to handle that. And certainly we wouldn't be able to handle that with the vaccine. So by asking for the strike teams and the governor agreeing to continue to vaccinate those facilities, that is being sent down from the state supply. If it comes through us, we have to handle it, and then we transfer it to them.
Okay, and where did the town of Palm Beach receive their vaccines from?
That vaccine was given, I've explained that, so I'm glad you asked it, because I'll keep explaining it. Originally, our task was to give it out to the fire rescue, so the fire rescue would start vaccinating. So we received the vaccine on the 23rd, and on that day, Palm Beach was ready to start vaccinating, so they came in and they asked for 1,000 doses to vaccinate their staff. The plan was to give it out to the fire rescue. On the next day, we sat down and we talked with the county and my staff, not without my staff, but I talked with the county. We spent the whole day strategizing how we would be able to equitably distribute this stuff, and we made the decision we did not have enough vaccine to give to fire rescue. I was not able to communicate that prior to my staff giving it out. So we stopped giving it out to fire rescue. We're in the point now where we're coming back and seeing if we can start giving fire rescue some of that vaccine so they can start vaccinating in their areas the same as Palm Beach did. So that was an error. I take full responsibility for that we gave it out too soon before we realized we didn't have enough vaccine to give to everybody.
But too soon and too much. I mean, there's no way the town of Palm Beach has a 1,000 staff fire department.
They gave it out, they gave the appointments out within 30 minutes, and they have given it out, and they're ready to do the second doses already.
But that 1,000 is not representative of fire department personnel in the town of Palm Beach.
No, they gave it for the patients, for the 65 and older. That was the plan, that was the original plan, that we vaccinated fire rescue, and then they would go out and vaccinate the public. That was the original plan, but we can't do it because we don't have enough vaccine to give to all the fire rescue people right now.
Okay. And then last, the healthcare district. They're receiving direct shipments because they're FQHC, so are they getting them from the state? They getting them from Washington, or are they getting those from you?
The healthcare district is two entities. One is a federally qualified health center, which has to do with their clinics, and the second is the taxing district that does many other things besides the clinics. They became an FQHC in 2013 when we stopped doing primary care and it went to them. We were an FQHC prior to that.
Right. And
So-
let's just put it on the record, it wasn't your choice to stop doing primary care. The legislature decided to cut that
No,
responsibility.
the legislation never prohibited the county health departments to stop doing primary care. It was a decision that we made here, and we were trying to send our primary care to the right entity that would be able to handle the very large volume of 63,000 patients per year. It had to be somebody that had the capacity to see that high number, had to have the infrastructure in terms of technology. We put it out to bid, and few people wanted to see patients, but they could not handle the entire thing. So it wasn't until 2013 that we were able to get the healthcare district to say that yes, that they would be interested, and they applied for and received the federal grant for the federally qualified health centers. It's an application that they have to go through.
Okay.
And so we were able to transfer those patients over to them seamlessly so that that primary care could continue. We're no longer doing primary care.
So each of those two entities, then, they're receiving vaccines from different sources or the same source?
Yes, it's different sources. That's what I started to say, that they've got a small amount from the federally qualified health center that is specifically slated for the underserved in the clinics that they serve,
And where is that coming from?
the feds.
Okay.
All the FQHCs got allotments. That includes Found Care, Genesis, and Florida Community Health, that's out in Pahokee. So in addition to that, then they're getting the 4,000 that they got on Monday is to serve the general population.
Okay, so
Not the general population, I'm sorry, the 65 and the healthcare workers.
I got disturbing news from staff on Friday that the first allotment of the FQHC vaccines out in the Glades, those are going, they're first calling patients of those clinics, and the first 300 calls that were made seeking patients to come in and get vaccinated, only one person accepted that appointment. So are we making any public health initiatives to try to encourage? I mean, I'm looking at your census tract data in the entire Glades area, and it would be helpful in the future if we could overlay that on a major roadmap so people have a point of reference.
Absolutely.
But I'm looking at that dark red area in the Glades once again, and what sort of efforts are being made to encourage people, to make them feel safe in getting the vaccine in that community?
We've been working with community leaders especially to get the word out. You and I going out there and telling them to get vaccinated is probably not going to work very well. They need to hear it from their community leaders. We need to reach out to the farm workers. We need to reach out to the churches. We're getting the church pastors and the different ordained leaders in the community to talk about it in the churches. Very similar to other areas where there's a lot of distrust. It has to come from within the community to get over that mistrust. So we've done Zooms, we've done going out into the community. Prior to the increase in the contact tracing, we were actually out at the different centers in Belle Glade, giving out the information about testing, but also giving the information about the work that was being done with the vaccine, getting people ready to know that a vaccine was coming. But there's a lot of distrust. So the only way to overcome that is with education.
Okay. And Ms. Baker, anything that our divisions can do to help in that effort? I do know that Commissioner Freed, our Ag Commissioner, is working on a program not to inform, I hate to use the word educate, to inform the farm working communities about the safety of the vaccine. Thank you for giving me a little leeway, Mayor Kerner. I think if anybody just heard the round of questioning that I did, as well as the Vice Mayor, and I'm sure Commissioner Marino has some follow-ups on that, you could see that we're all equally confused about what's going on right now. It seems to change from day to day. Your budget Your FTEs, which is your staffing levels, have been cut over the years. You are operating at razor-thin margins right now. So I appreciate, Dr. Alonso, everything that your team is trying to do with a very demanding, and rightfully so. You brought up LA County. LA County yesterday alone had 1,900 deaths. They are loading bodies into refrigerated trucks in the hospitals, and people are having to wait in ambulances to even get brought into the hospital. I don't want to see our counties head in that direction. So I appreciate all of the efforts that you are making and that your team is making. This is an absolutely chaotic distribution. I look forward to April, and I'll keep my fingers crossed and try to remain optimistic that we're actually able to do general population vaccinations, but what I've seen so far does not impress me. It worries me. I feel awful when I've got constituents call and say, I've got one lung. Autoimmune disorders, cancer patients, they can't get this vaccine, and it's a disgusting distribution, and I hope that changes come January 20th. Thank you.
It will. Be hopeful.
Thank you, Commissioner McKinley. We're going to go now to Commissioner Marino and then to Commissioner Weiss.
Thank you, Mayor. Dr. Alonso, thank you. I know this is a tough time for all of your staff, and sitting here getting peppered by all of us, I appreciate the time. I do have several questions. I'll try to be succinct in my questions. One is the supply for booster shots. How are we taking care of that?
You mean the second shot?
Correct.
That is supposed to be coming to us based on the vaccines that we have given.
So is
That's
that
the-
separate than the 4,000 we received today? Is that a separate allotment that's specifically for boosters?
We will have to handle that individually because I can't depend on what is being promised because I don't know if it's going to happen or not. So for example, last week, even though I knew that we were going to get a supply on Monday, and I even saw it on the status that it was coming, I went ahead and saved vaccine for both Monday and Tuesday, just in case it didn't get to us. If I had not done that, I would have not been able to start my 8 o'clock clinic because we didn't get it until noon. So it's with, caution that we hope that we will get it, but we know that vaccine has changed. When we were the first 8 counties to get the vaccine, we got 20,000. Then when they opened it up to all 67 counties, we only got 4,000. So I was expecting to get 20,000, like on an increasing, not decreasing. So those things all have to do with the supply.
It sounds like there's going to come a time where, I didn't mean to interrupt you, but it sounds like there's going to come a time where we're actually going to have to stop giving the first shot, and whatever we receive now becomes I'm calling it the booster, but the second shot.
Yes, when we're doing our appointments now, and we're already working on that, that's a decision that different counties are doing in different ways. Some counties are doing like vaccinations only in the morning, and then the afternoon will be set up for the repeats, the second
And
shot.
how do you propose we handle it here?
We're trying to increase our ability to vaccinate. We will be moving to a new location so that we can increase our productivity so we can do both. We can continue to give the second dose as well as continue to give the appointments out. And we will also increase with the use of the healthcare district being able to go out and start doing mass vaccinations. So we are hoping that as we can continue to advocate that we have the capacity in Palm Beach County to do much more, that as the end of January comes around and we start doing those second doses, that we will be getting more vaccine to be able to do more, not less. But you're absolutely right. You calculate things very well. You realize that if you have to give the second vaccine, the only way to do that and still give vaccines is you're going to be able to only do half of the new doses, right? So how we do that, whether you split it in mornings and afternoons, or, it comes out cutting. So the only way to overcome that is to try to be able to do more by increasing your productivity.
Well, we can increase our productivity, but it all depends on the supply
Exactly.
at the end of the day. For those that are listening today, could you please explain the difference between our health care district and our Florida Department of Health in Palm Beach County?
Absolutely. And a lot of people still call us CHD, County Health Department. And if you notice, it's the same letters. Now, when they named it Healthcare District, they did that on purpose. Probably not a smart choice. The Healthcare District is a taxing district that is run by a completely board. I sit on that board permanently as my position as Director of the Health Department. There are 3 positions elected by the governor on the board and 3 positions on there by the county commission, or the county. And so that entity is basically the safety net to provide the health care for those uninsured patients in Palm Beach County. It also has the Trauma Hawk, which provides services to everybody. They also have the nursing home at Healy Nursing Center that they do. It's a very different nursing home than you would think. It has mostly people who are disabled and has a much younger population than you would think of as a nursing home. And they also run the Lakeside Medical Center, which is a rural hospital out in Belglade.
And then
And
our
The Health
Department of Health.
Department, which was changed to the Florida Department of Health, Palm Beach County, very long name for people to say. People still call it just the Health Department. Our county health department is one of 67 counties. We have a centralized system in Florida for public health, where all 67 counties are part and report to the state in Tallahassee. From a public health perspective, that's a really good model because we have each other to help each other out in emergencies, especially hurricanes that happen a lot. We're able to mobilize staff from one county to the other, and we're pretty much know each other, and it really is a good safety net to be able to do it that way. And so we take care of sexually transmitted diseases, we do tuberculosis, we do hepatitis, we do vaccinations. Palm Beach County is a little larger than most other health departments because we have a very large environmental health program. Palm Beach County does licensing of health of the daycare centers that other counties do not do, that DCF has given us that authority to do that. We do air control here, air monitoring, which other counties do not do, so we have a very large environmental health. We have a huge WIC program, that's a Women, Infant, and Children, that does supplements for children and mothers underweight or overweight. And so there's many components. My most important department, and the one that, believe it or not, is not funded through general revenue, is my epidemiology department. We have maintained that department strong because epidemiology is the basic unit of public health. It's the investigators, the detectives. And so we have always in Palm Beach County kept that department strong. And thank God we have, because this is a perfect example in an emergency. That's the #1 department that you need to have. So we're very proud that we are, despite our cuts and despite all the years that we have been cut, we have kept a strong department and a wonderful relationship with the county and the healthcare district. We're really one unit that takes care of the people in Palm Beach County.
So the reason I asked the question was because of the supply chain, which a lot of people don't understand the supply chain right now and who's getting what and who's dispensing what. So we have the healthcare district that is getting its own supply separate from our Florida Department of Health in Palm Beach County. We have CVS and Walgreens that are getting their own supply, not from us or the healthcare district. We have hospitals getting their own supply, not from us or the healthcare district. So what, you know, just like when the phone lines opened for Obamacare and crashed for quite a while, we have
Good example, I gotta use that.
We have a large population. We have that 400,000 population that you've been talking about. And earlier on, one of our first meetings, we talked about how many beds the ALFs have, which is about 13,000. So those 13,000 in the ALFs are getting their vaccinations from a different supply chain than your department, correct?
Correct.
Okay. So that whittles our 400,000 down just a little, but not much. You know, it's a lot of information for our seniors to take in and understand. And you know me, I'm a numbers person, and I will always be a numbers person. That's not going to change. And I will help try to make it clear for everybody out there. And I know we have a lot of other commissioners that want to ask questions. Hopefully, I've asked ones that now others don't have to ask. But the last comment the last question is, please explain what a pod is and where are they getting their supply?
Be glad to. A pod are the initials for a point of distribution, or a point of dispensing. So dispensing is when you do medications. For example, with anthrax, we have this, when we did our doxycycline, those were pods of dispensing, we were giving out pills. In this case, it's the vaccination. So it's a pod of distribution when you do things like water and you're distributing food. So a pod is just a name for a place where you're going to go to get your vaccine or you're going to go to get your testing. And so when we talk about these pods, we're talking about locations that we set up. For example, when we went to Kings Point, we came in, we had the staff go ahead and set up appointments. In 24 hours, we set up this pod, this point of distribution for that vaccine that includes everything that you need, from the supplies to the staff and all the organization that surrounds it. Security, everything else has to be included in that.
So we have a lot of communities that are set up as points of distribution for medication, for, as you said, anthrax and what those the examples you gave. What is their procedure to pivot to being a point of distribution for the vaccine? And we, as our Palm Beach County Department of Health, Florida Department of Health in Palm Beach County, we have no control of them getting the vaccine, correct?
Yes, so.
That was sort of a question and an answer and a comment altogether, but.
Yes, we changed that a little bit. We tried to explain to all the people that were set up for City Ready for the pods in terms of dispensing medication that this was different. In a dispensing of medication, you basically are just giving out the pills. It's technically much easier, and you need different staff. Here, you need somebody that's a vaccinator. You need a provider to be responsible for that vaccine. This is a medical procedure. This is not giving out medications. So it's very different. So with communities and people who want to gather and be that point of distribution for the vaccine, there are a few different things that have to be done. For example, they have to have a provider. They have to get signed up for Florida shots, because only people that in Florida shots can be providers for the vaccine. They may have to do a contract with somebody who's already in that line, or we will have to go out to them to be able to do it. So I think there's going to be a combination of different ways to do it. There may even be ways for people to actually pay for a contract, to have somebody come in. I have one lady that's calling me every day that she does different businesses, and she has a mobile unit, but the people that she vaccinates is not in the executive order. It's for another group that's not been. So I had to tell her, I'm sorry, but that group is not available yet. When it comes to the general population, we can call those kinds of people to help us do those things. So it's a little frustrating because they are ready to go. But again, think of a large pod like Kings Point. You're talking about thousands and thousands of vaccines that will have to be dedicated for that pod. So
And the pods are not getting their vaccines from us. They are getting them from, are they getting them from Moderna, from Florida Shots, from Pfizer, from the state, from the feds? Where are they getting their shots?
at this time, the pods in Kings Point and Century Village, that vaccine is being diverted through the state because they're doing that with the strike teams. We're not doing that vaccination there.
Okay.
So for a pod that gets created, let's say next week, we would have to take that 4,000 vaccines that we have and give it to that homeowners association or whatever it is. So
That's if they do the pod through us.
Yes.
What about doing it through Florida Shots?
through Florida Shots, there's no delivery of vaccines at all through Florida Shots right now because there's no supply.
Okay.
So it goes back to the supply. And so the decision, who do you give that little bit of 4,000 is impossible to go to a large community. And so the large communities are saying, well, why are you discriminating and not giving it to us? Well, do we just give you 50, go away and not see you again? I mean, so these are some of the decisions that may not seem fair to people. We're trying to make good choices and make it go as far as we can, concentrating on those seniors and healthcare workers right now.
Last question. You're looking for volunteers. What qualifications do the volunteers need to have?
Well, it depends. I mean, we have from people being able to answer phones to nurses being able to give vaccines. So it really runs the spectrum. We have a volunteer department that is working, but we're also have the Medical Society has the Medical Reserve Corps. So we're trying to utilize them to sign up as volunteers to the Medical Society, through the Medical Reserve Corps. So if they look up Medical Society, Medical Reserve Corps, they can go through them to organize it and be able to then pass it on. But we can also, they can also do it through the health department. But we'd rather use the Medical Society, that Reserve Corps that we've been having for years, that we have people listed there already that are able to do different jobs.
Well, I'm not a nurse or a doctor, and I don't play one on TV, but I am very happy to volunteer to answer phones.
We'd love to have you.
Thank you. I'm done. Thank you.
Thank you for that, Commissioner Marino. We'll move now to Commissioner Weiss and then to Commissioner Bernard.
Good morning.
Good morning.
I've got some, just some questions to you regarding the situation with coronavirus, and then talk a little bit about vaccine. I mean, to me, and watching the numbers, it looks like your predictions about the surge of cases has come to fruition, and that, we're seeing levels now that are higher than what we saw last spring and summer, and, correspondingly then the numbers of hospitalizations and ultimately leading to the number of increasing deaths, not only in Palm Beach County, but throughout the state. Can you talk about what people should and should not be doing?
The most important thing that everybody needs to be doing, including those who are getting the vaccine, is to not think for one moment that this vaccine is the magic bullet. We have a long way to go before we have herd immunity, which means that we still have to wear our masks. Now more than ever, our numbers and the virus in the community is higher than it's ever been. The number of positive people in the community is higher than it's ever been. We have the new, more contagious virus in the community. And so people have to be really, really careful now. And unfortunately, people's guard has come down. There's like this feeling that it's all over. The vaccine's here, it's all over. And if you walk down through the downtowns of any city, you see that people just simply are not, they're tired of it, they're giving up or whatever it is. And so there's a lot of people that are gonna die unnecessarily because of this. The seniors, for example, say, I want to get my vaccine, I want to get out of the house, and I'm telling them, no, you still need to stay home, you still need to be protected. It will take some time before you get that second vaccine to have protection, and even then, we don't know how long this vaccine's going to give you protection. So we still have to be very, very careful until we have that herd immunity and we have this vaccine working long enough to know that it's going to protect us long enough, or at least for a year before we get the vaccine against next year. We don't know if we're going to have to vaccinate every 2 years or every year. So there's a lot of unknown yet. So yes, there's a huge light at the end of the tunnel in terms of herd immunity, but it's a long tunnel and we're not there yet. So wear your mask, do the social distancing, and everything else that we have talked about, the 3 C's. Don't go into crowded spaces. Don't go into where you see people all gathered together on top of each other, the bars, the restaurants with tables right next to each other and people talking without their masks, having so many people have called and became positive, and the answer when they do the contact tracing is, I went out for the first time. I hadn't been out in 9 months, and I went out to celebrate a birthday, and the table we were all eating without our masks, but we were right next to each other, and one person had it and all 6 people become positive. So we have to keep in mind that the virus is still out there, and we need to do all those things to protect ourselves until we do have herd immunity.
Okay. Are you seeing any reactions or any types of interactions with people taking the vaccine in terms of the safety of this?
We've been very fortunate that we haven't had any severe reactions in Palm Beach County, but there's certainly plenty that are reported. There was a physician that died after taking the vaccine, but we don't know if that had anything to do with the vaccine or not. But every single reaction that occurs is being reported and documented because that's why we do this. The reactions, the side effects that we have right now is a slight pain in the arm after the vaccine, starting about 6 hours after you get the vaccines. It gets a little sore. The second day, you're sore, and it goes away by the 3rd day. People that are allergic to or have anaphylactic history, it's very important that they talk that over with their doctor, and that's why we have the EpiPens available for the anaphylactic shock. We had a gentleman that has anaphylactic shocks, and he came to get the vaccine with his EpiPen. He goes, I have this with me. I often have reactions, and I know what I need to do. And went ahead and took the vaccine. Thank God he didn't have a problem. But so those are the things you have to be careful about. And if you have any questions, you're supposed to, of course, as always, talk to your doctor first before you get your vaccine.
Okay. Is there any visibility to the supply that's coming to both the state of Florida and to Palm Beach County? Is there any I know we had transparency in other things, but how about in the supply of the vaccine?
We're doing a report that shows the vaccine that we have and what we are dispensing. But I don't have visibility in what's coming into Florida. At least I don't, and I haven't looked for that. I'm busy trying to get my vaccine and get to what I'm doing, so I haven't been looking for that.
Okay. As it relates to the email sign-up and responses, and I saw our director of ISS in the back of the room sort of cringing while we were having, Commissioner McKinley was asking some of these questions, but isn't there, why can't we create an email address that is more user-friendly, that just auto-forwards to the Florida Department of Health email system? If you can't build a new system, there's certainly, the technology is there to do that. I don't know, and I'm sure you're probably not the person to ask, but maybe it's something you could follow up with them up there, because there's, as far as I know, and I'm looking at Archie now, I don't see any reason. We do it all the time for lots of other things, and it just auto-forwards to them, and it can also send an auto-response and not be limited to that, whatever the limitation of their system is.
I will certainly ask up the chain to the IT, and Commissioner McKinley rightly said to contact the name that she has. Part of it is that we have a system that is definitely not user-friendly.
Understood.
When the last Surgeon General changed our email, it went from one email to another one that was supposed to be easier, and I was like, seriously? This is just as complicated as the other one. There's a lot of security connections in our systems, encryption, and all kinds of other things that I won't even get into for security reasons, but it makes it very difficult to do anything in our system. It's not the kind of system that your sons and daughters would want to have to work with.
Are you providing cards? When somebody gets vaccinated, are they getting a card?
Yes,
And are you recommending that people take a picture of that card and keep it in their phone?
that was
So-
an excellent suggestion that was made. Yes, that's certainly what I do with all my cards and all my insurance cards and license and everything else. I take a picture and keep it in my phone. So yes, that's a very helpful hint.
Yep, I think it would be good. And then, is there a reason why you're not using, I know when I go to the doctor, I get a text message reminding me of my appointment, and are you guys looking at implementing any kind of a system like that so that it automatically reminds people and they can respond directly to that and not have to interact with people?
We do texting, and it's very useful. The patients really like it. The Florida shot system is a reminder that will be a call. We can certainly do texting. That's an option that we would be able to do. We'd have to make sure that the phones that we have are their smartphones that can accept texting. We have to get permission to send them a text, so that would be another thing that we have to sign off on.
I know you guys are working on developing a web-based sign-up. Any idea how long it's going to be before it's available?
At this point, the one that we were trying to develop did not pass the test for the volume. It crashed. So we're going to hopefully be able to do that through the healthcare district when they go into their phase where they'll be setting up. They have been working on and created a web-based system that will be able to take appointments, and we'll be able to put people into those appointments.
Okay. I'm hearing from teachers, they want to go, they're being asked to go back into the classroom. They're asking the students to go back into the classroom. What should they be told because they're not in this priority group?
That's right, they're not in the priority group. The CDC had recommendations, different scenarios where they selected different populations. One of the populations was teachers, especially older teachers. So if they're over the age of 65, they can definitely sign up to get the vaccination. The good thing is that in our schools, the transmission of the virus has not been in the schools. The transmission of the virus is outside the community, bringing it into the schools, and we have not had transmission in the schools. So I was speaking with a person that works in the school who is 79, and she's still volunteering and working, and God bless her. And I told her that, yes, we would get her signed up to get the vaccine, but that the schools are actually pretty safe, that the transmission is not occurring there.
Okay. I mean, I think this has been a frustrating experience, I think, for a lot of people. I know you are frustrated. I know we're all frustrated by how this has happened. But, I looked at the numbers, and you mentioned them earlier. I mean, Palm Beach County, 42,000 people have been vaccinated so far, which is far short, right, of what we need. But it's a lot in the period of time relative to the number of vaccines we've got. Hillsborough, I think, is at 27,000. Pinellas is at 27,000, and Orange County is at 38,000. And they also got, I believe, the Pfizer vaccine and got it 10 days before us. So, I mean, is it fast enough? No, but you apparently you're doing a lot of good work to try and get us caught up. I just think that it's people they're chasing this vaccine. They're, and rightfully so. They're concerned. I mean, we know the impact it has on people in the older part of our population if they were to contract the virus. But, so for people being patient, and again, so you're recommending continue to do what they're doing, to stay at home, to stay away from crowds, to stay away, if they go to the store, to continue to wear their masks, socially distance, wash their hands, continue on. But it's going to take months.
Yeah, it will definitely take past the summer, because then around, late spring, early summer is when we'll be able to do the general population. And so at that time, we will be having the flowing of the vaccine. And so once we get to that 70% of the population being vaccinated, we'll be out of the woods. So that's a long way from now, and I know people don't want to hear that, but, that's the way it's going to go.
Right. Is there anything that we or the public can do to make this any better, easier, faster?
I think the most important thing is that we lower the expectation and that we emphasize that it's a supply and demand issue. And I'm very hopeful that we will see the federal supply start rolling out very soon. It's not conspiracy theories or anything else. It's simply that in every vaccination program, you have 3 phases, and the first phase is very frustrating for everybody. And so we have to be patient. This, in this age of instant gratification and delivery within 24 hours, it's very hard to explain the situation we're in. So please be patient. The vaccine will be here. Everybody that wants this vaccine in Palm Beach County will be able to get the vaccine.
And then my last question is, and this is to follow up on Commissioner Marino's question to you. So if you're getting 4,000 doses a week, we've got 42,000 people now in Palm Beach County that have been vaccinated and are going to need a second dose. The math is, if you're only getting 4,000 a week, it's going to take you 10 weeks to revaccinate those people. Do you have any sense that you're going to be getting a larger supply?
I don't have the sense that I'm going to get a larger supply, but I do have appointments already set up. So every day from the 23rd on, we will be giving the second dose and vaccinating the public.
But how are you going to vaccinate the public with that? If you're only getting 4,000 a week, and you've got 42,000 people right now that are going to need that second dose.
So the answer is exactly what Commissioner Marino said. You either cut the new people that you're doing in half, or you get more vaccine to be able to do both. We're hoping that we were promised that we would get sufficient vaccine for that second dose. So we're hoping to get more vaccine. If not, then we have to go to the alternative of cutting down the new people and vaccinating. If all I'm going to get is at 4,000, I got 2,000 to vaccinate and 2,000 to repeat my dose.
Okay, and I guess then I said that was my last question, but I've got one more, which is there's been talk now of people just doing one dose and, moving on to the next.
At this point, that's not an option, and I hope it's not an option because all the studies show that you needed the second dose in order to get maximum
Efficacy.
effectivity, right? So in order for it to work the way it's supposed to work, if we decrease that and just do the one dose and say we only have 50% coverage, then it's going to take that much longer for people to make this go away. If we have a vaccine that only does 40%, we'll basically have the same kind of vaccine that we have for the flu. It's great for the flu, but it's not so great for something that, puts you in the hospital this way. So the purpose here is to vaccinate the way that we're supposed to be vaccinating. And I don't see anybody that has actually made that a medical decision. I think Europe is thinking about it and so forth, but I hope we don't do that here.
Okay, all right. Thank you very much.
Thank you, Commissioner Weiss. We're going to return briefly to Commissioner McKinley and then to Commissioner Bernard.
Thank you. And Commissioner Weiss, I think one of the vaccines that's awaiting approval is a one-dose vaccine. There's a vaccine that's awaiting, it's a one dose. Just a quick follow-up question. One of the frustrations in being a county commissioner right now is the idea that this is being run by the state, but because you've got the county in your name of your department, we seem to be taking a lot of the hits. People don't feel like they're being communicated to enough. So my question, Ms. Baker, is there a way that we can use, we use social media, but not everybody is on social media. Is there a way we can use our emergency alert text system to send out information about how to sign up for a vaccine appointment, how to send that email, and who the priorities are right now?
There are some restrictions, however, we had this discussion again last night. It has to be targeted and specific, and we need to get permission, but we are looking into that as we speak. We talked again last night about it, so we can take the list that the doc has, the 100,000 plus, and then be able to target them with a message so that they understand what's going on and how we'll be able to do it. But there are limitations as to how we can use the system.
Okay, thank you for looking into that.
But I do want to point out that Combat COVID, which is a software that we've invested in for this particular purpose, if people would sign up, it is a voluntary method, but we would create such a database so that we can reverse and send information out to them. After this is over, after a year of utilization for the primary purpose in which we purchased it, we will also be able to then just turn around and send messages to anybody that has, all of our residents that have signed up in the future. That was one of the highlights of purchasing COVID Combat. So I'm going to encourage our residents to please download Combat COVID, because it's not just to tell you when you've come in contact with somebody, but it's also a means that in the future we'll be able to reverse and send information out to you. But we are checking on the other use of the 911 system.
Thank you.
All right, thank you, Commissioner McKinley. We'll go now to Commissioner Bernard and then to Commissioner Sacks.
Thank you, Mr. Mayor. Dr. Alonso, just want to thank you personally for your dedication to the residents of Palm Beach County and to the state of Florida. Just had a couple questions. You had mentioned the strike team, and I know that they're working with the long-term care facilities. Just want to know how they're doing, and are we reaching some of the long-term care facilities in Palm Beach County?
Okay, the strike teams have not begun to do any of our long-term care facilities in Palm Beach County. The contract with CVS for the, they were supposed to be doing the long-term care facilities in terms of skilled nursing facilities and nursing homes, and the assisted living facilities. So my understanding is that they're going to continue doing the nursing home, the skilled nursing facilities, CVS, and that the assisted living facilities are going to be done by the strike team. That has not begun yet.
Okay, and you had mentioned in your slide that the strike team is in Broward and in Pinellas County. Would we need to request a strike team for Palm Beach County, or does the one that's in Broward, will it be able to handle probably Palm Beach County and Miami-Dade?
We did request a strike team. They're the ones that are doing Kings Point and Century Village, and now they're going to be doing so we've already requested that and got it. We knew that we would not be able to do those specific facilities all by ourselves. All our vaccine would have gone to only probably a third or a fifth of the people that they've vaccinated.
So that means like if we needed to get the strike team, you pretty much can request it and then we would have it available to the residents.
Well, now the strike teams are going everywhere because they have not been able to fulfill the contract with CVS doing it. So the fact that they're going in and having to supplement these contracts that were already in place is probably going to put a strain on the strike teams.
So is it possible for us to request a strike team to be in Palm Beach County or just
For
keep
what
it
specific?
to address the assisted living facilities? Do we need that or?
We did. We got one to do the assisted living facilities.
Okay, thank you. The other question was just a follow-up to what Commissioner McKinley had mentioned in regards to, only one resident has signed up for to get the vaccine. We know that there are many residents. Right now, we're only in phase one, and there are many residents in Palm Beach County, specifically brown and black folks, who have some concerns in regards to vaccination. And so what we've done is partnering with Dr. Alonso, we're going to have a town hall on January 21st, which is Thursday, January 21st, between 7 p.m. and 9 p.m. with local doctors. This town hall is to residents throughout Palm Beach County. So in that way, we can provide information to some of our residents that have concerns in regards to vaccination. And so what I would love for us to do is, as we provide the information to the residents, if different district commissioners can, filter out to your communities, so in that way we can get people to get the information in regards to vaccination. Thank you.
Very good. Thank you, Commissioner Bernard. We'll move now to Commissioner Sacks and then to Vice Mayor Weinroth.
Thank you much. And I want to thank you, Dr. Alonso, for all you've done. This has really been an amazing deployment. And what is especially frustrating, I think, is that the public as a whole has been affected by a pandemic that's life and death. It is up to government to be able to provide them with a vaccine and a way to communicate. And what we have here, to take from a movie years ago, is a failure to communicate. And I want everybody to understand that the email address that we have published as county commissioners to the people to be able to make an appointment is not a county email. It is a state-based email. We finally have in this state a chief of information officer who's a former state representative, and I want people to know his name so they know who to write. His name is Jamie Grant, Grant. Just appointed before this all occurred as a chief information officer for the state of Florida. Now, this particular, his background is in information technology. He's a state representative. He's a very fine person to head this. However, we need to let the state know that they need to put the funding into this information technology, because we in the county can't do anything about it. Everything goes back to the state of Florida. So when our state representatives and state senators want to know, why is it that we don't have this information technology up to speed, which we don't, that falls within the state of Florida. So Jamie Grant is the person to contact to make sure that we get up on better technology. And I think that's extremely important, because we all here are getting emails. People are frustrated. They can't get on that, that particular email. They're not getting anything back. We're dealing with 21st century pandemic with basically 19th century technology, and we got to get up to speed.
18th century.
Probably. We have to get up to speed on that. Now, just so that people understand what we have going at Kings Point in West Delray and the Century Villages, because I know there's Century Village Boca is receiving it, Century Village West Palm Beach, and I've also heard that Century Villages in Deerfield and Tamarack are also receiving the vaccines. In your estimation, your professional opinion, how is it going there at these sites, the two sites, or actually the three sites that we have here in Palm Beach County? How is that going?
I think it's going extremely well, and if we could do that at every site, we would be out of the woods very quickly. But that's going to take what? It's going to take supply, and it's going to take staff.
And
So-
as the supply comes in, Doctor, from my reports, because I've been asking the strike force at the two sites that we started, they're vaccinating approximately 500 people a day. And that's what they are, as soon as they get the supply, it's being administered. Thank you so much. Thank you so much for that, and for the strike force that is working at these facilities. It has worked out very, very well. With regard to pods in communities such as the Jewish Federation or our country clubs, our community centers, such as Cobra, the Alliance, West Boca Community Council, do we have any idea when they will receive a supply of vaccines to be given out at those pods? And where would that supply come from?
If it comes the way it's coming now, it would come through the Department of Health.
Which
for-
is a state.
Well, when you say the state, there's two pieces of the state, and I believe that the person you're talking about into IT is under the governor. When you say the state, you're talking the governor and his office.
The chief information officer works under the executive administration of the governor.
Of the governor. So that's a state in terms of the governor.
Correct.
When the Department of Health talks about the state, we're talking about the state of the health department, the Florida Department of Health department. So we're state employees, so it gets very confusing. So see, we want to continue the confusion. So right now, the way the vaccines come into the counties is probably through three different areas. Well, four. You have the hospitals, you have the long-term facilities, you have the county health department, and then you have special projects that through the governor is doing. So today he's at a drive-through. That's another idea that he's decided that they're going to do drive-throughs. We had drive-throughs here. I think he saw that firsthand and was very impressed with it. So there's multiple people doing these things, and therefore that little bit of vaccine that we're getting at the state level that the governor
Right.
gets from the feds is going out to all these different projects and all these different things that are happening. So 15,000, for example, went to Publix in those three counties. A certain amount will go through this drive-through. Another amount is going for these churches. So every time that happens, the supply that we're getting locally decreases, which is why I think we're only getting 4,000 right now, because every time one of those ideas comes out, that's the vaccine that the state has to distribute.
Would that be the reason why our supply here in Palm Beach County has decreased from the initial supply numbers that we had? Wasn't anything that we did in Palm Beach County that we, all of a sudden now he's decreased it to, I think, 45 something, you know?
Yes,
Is that-
4,000 actually.
4,000, probably. And that was the reason, not because of anything that had initiated here from Palm Beach County.
Correct. And so, because there's a limited amount, every time one of these projects comes up, so we were only 8 counties that got to 20,000. And then when it opened up to 67 counties, part of our supply had to go to supply those other counties. The other counties, Martin, for example, got 500. So I was supposed to be thankful to have 4,500.
Really?
but-
And then another thing that has been of concern to a lot of constituents is that there's homebound seniors. Some of these folks live in the pods that are receiving it, have received it for the last week. That is Century Villages or Kings Point. will we be able to provide a vaccine to the homebound seniors through our mobile units at some point? Doctor, what do you?
Yes,
what would you
that is,
foresee?
that is in our plan, very much part of our plan, just like it was for vaccinating. So think of all the things that we did for vaccinations, the drive-throughs, the mobile units, going to the homes, all those things will be available with the supply coming our way.
And can you comment, and if you can't, that's fine, can you comment on the possibility of having vaccinations given, just that you were discussing, like for testing? Testing is going on right now at the South County Civic Center. Do you foresee the possibility of being able to do the same as we did for testing as we can do for vaccinations? That is, whole-scale vaccinations at centrally located areas within the county.
We totally have plans to do exactly that. We're calling that mass vaccination center, that we would be concentrated where we could do 1,000 vaccines per day. And we could, then have the lines through for the repeats, vaccinations going through that. But it all requires supply.
And that supply is not originated here in the county.
And as much as I scream up there, I'm probably getting a little bit more than I would have, but it's going around to different places.
The supply is coming from the federal government to the states, from the states to Florida, from Florida to 67 counties.
Correct. That's exactly it.
And I want to thank you, because the areas that have been chosen by the governor to receive the initial supplies of vaccine, which is about 500 a day, I get tallies that they are doing. They're mobilizing, they're administering the 500 a day in a equitable, fair, and safe way, as we know today. And I want to thank you for the work of you and your team and the strike force, because we're getting there. We're getting there, and we're learning. Thank you very much, Dr.
I think
Lawrence.
I'll add a slide of distribution. That's a great
Yes, thank you.
schematics that people will understand that.
Thank you, Commissioner Sachs. We'll move now to Vice Mayor Weinroth.
Thank you, Mayor, and I guess I'll be tying it up. I seem to be the last light up, so we're going to break this off. This last 90 minutes, I think, has been important. I think our stakeholders are, looking for information. I think that this has been an opportunity for you to bring everybody up to speed, both us and the people who are watching, and of course the news outlets that are going to report on this. But this is fluid, and something has changed since we've been here talking. The governor is up at the Villages, and apparently he had a press conference today, and he made the following statement. He said, "We are not doing vaccinations for tourists." He said, "We are not doing it for interlopers." So it appears that our governor is making a position that we are not going to be a tourist destination, or as they now are calling it, vaccine tourism. And so I'm going to ask you to reflect upon the governor's latest statement on when you are going to set up your appointments. Obviously, you said you're sitting on 100,000 people who have sent you emails. And if there's any way to cull through those people who are obviously not residents and not snowbirds, but people who are just coming here to enjoy the flexibility of our governor's edict, then I think that it's important that we, again, make sure that our residents, whether they're part-time or full-time, have first access to those vaccines.
I'm sure we will get direction from the Department of Health as he communicates that to us specifically. It'll probably, I imagine it would be like having to have an ID with address or something like that.
Right, and I appreciate that. And he also mentioned that 296,000 residents over 65 have received the vaccine in Florida. So again, we are making progress. It's just a matter of, it's going to take a while. And from your math, if you're getting 4,000 doses and we have 100,000 on the wait list, it's going to take a few weeks to get through that wait list. So please be patient. Thank you very much, Doctor.
My pleasure, and that's what I'm here for, so glad to do it.
Thank you, Vice Mayor Weinroth. And we know that vaccine interloping is not welcome in Florida. We've had that happen here before. And I can assure you that the proper authorities are investigating that particular incident, and I hope they find what we're looking for. I just have one question, Dr. Alonso. there's 49 other states that are also competing with the federal supply and various territories and districts as well. Florida has a limit on what it's getting at this point, and I've read some comments in the press about a change in strategy between the current administration in Washington and the incoming administration about how they open up that supply chain. Have you read about this at all?
I have heard it being mentioned, but I just, my answer was, let's wait and see.
Right.
You know, supply, while it should be probably, it all depends on how much they're making, and, you know, we don't have eyes on that, so it's tricky. I can't imagine that vaccine would just be sitting there. I don't know any reason for that. So let's see what happens. I'm a little, I'll see it when I'll believe it when I see it.
Well, and you and I both, and so what we're doing is managing expectations at this point and assuming not a worst-case scenario, but a scenario where for the foreseeable future, the supply chains do not open up. I think there is some potential that with the change in policy, we may see a much larger distribution of vaccines after the new administration comes in. My understanding is that under the current model, they hold vaccines in reserve to guarantee that second booster shot, which is obviously a very positive policy aspiration, versus the new administration may open up the full supply chain with some sort of guarantee that the booster shots will flow from production from there on. So I guess you don't have an opinion or a perspective on that. Are we aware of, in the history of the United States, where the president has utilized the Defense Production Act to say, share your vaccine formulas and get this produced as quickly as possible? Because I know there are other companies that are awaiting approval as late as into April this year for a vaccine. And maybe I'm just as ignorant as they come, but I feel like if one company has mastered and found a way to effectively produce a vaccine with the proper efficacy, that they ought to take that and carbon copy it with another production facility under the force of the United States government.
In 2009, with the H1N1 vaccine, which occurred in a very similar fashion, there was not the cooperation between pharmaceutical companies, and it was one pharmaceutical company that actually came up with the vaccine first. So that did not occur in 2009, but I'm not aware of the historical events that have occurred in the past. I think what happened this time was really a unique cooperation worldwide in terms of competing pharmaceutical companies working and sharing information that has never happened before. So that's why I'm very hopeful, and I know that the flow will continue to flow and get stronger. It's just a matter of, you know, the first productions of these things that always take time to rev up to be able to have sufficient for the general population.
All right, very good. Commissioner Weiss, you recognize, sir.
Thank you. Just something that I was thinking about. I mean, we've been getting reports of wasted supply of vaccine or spoiled vaccines. Do you have any insights? Is that happening? And I appreciate you commenting on that.
Yes,
Thank
that
you.
is a report. We have 0 wasted vaccines that I'm aware of in Palm Beach County.
Very good. Well, let me speak on behalf of the board again. I know they each shared their special compliments of your public service here in Palm Beach County, but on behalf of the board and the people of Palm Beach County, we deeply appreciate your commitment and service, and we do look very much forward to working hand in hand with you as we have throughout the entirety of this pandemic. Thank you, Doctor.
It's my honor to do that. Thank you.
Yes, ma'am. We'll move now to Dr. Bill Johnson, and if there's no objection to members
Poor
of
guy.
if there's no objection to members of the board, I have asked, with the permission of the county administrator, to have a very brief presentation added to presentations by our Assistant County Administrator, Patrick Rudder, on the the COVID Education Compliance Team, so that you can hear what that unit is up to. Mr. Johnson, you recognize, sir.
Thank you, sir. Thank you, Mayor. Thank you, Commissioners. This is the 302nd day of our Emergency Operations Center's activation for COVID-19. Again, I'd like just to pause for a moment that that's 300 days of continuous activation of the Emergency Operations Center. Do we have to hit the deck?
I don't hear it.
So I'll move forward. Again, 300 days, and there have been at least 60 people in the Emergency Operations Center that have been involved in this, many of which have been involved in this since day one. Many of those folks have gone without or with very limited vacation, and I'm talking about my incident commander and many of the assistant county administrators and department heads and some of my logisticians and staff. So again, I'd like just to take this opportunity to say kudos to them for a anniversary that is for unsung heroes. I think that is insurmountable here. With that being said, just moving forward, you have a copy of the CPR, the COVID phase restart program. I'll move through that very quickly. As you can see in the matrix, we did not meet 6 of the indicators. Last week's report, we did not meet 7 of the indicators. The total positivity, as Dr. Alonso mentioned, continues to increase. We're currently at 14.6%. The red line on the lower left-hand graph indicates a 7-day running average. The upper graph shows that our positivity rate has been steadily rising since a low of 12.14% in October. Our daily lab positivity rate, the upper right-hand graph shows how it's been increasing steadily since mid-October. The lower left-hand graph shows that during the past 2 weeks, our daily lab positivity rate has averaged 10.25%, which of course, as Dr. Alonso points out, is well above our targeted 5%. Our hospital census, the chart in the lower left shows that over the last week, we again saw more patients hospitalized with COVID-19. We're seeing over 8% of our total hospital beds countywide being used for COVID-19 patients. The last time I presented to you personally was December 15th, and since that time we've seen an average of 129 more patients per day countywide. Note that local hospitals are running an average of occupancy rates of about 78% this week. In terms of COVID deaths or mortality, the graph in the upper right shows that our COVID-related deaths continue to slowly decline. We have seen our death rate, that is the number of deaths divided by the total number of cases, slowly do so since mid-July. It currently stands at 2.13%. However, ending January 1st, the 14-day average for daily deaths has increased from 1.5 to 1.9 deaths daily per day, I should say. Our ICU cases, over the last week, we saw more COVID ICU patients. We saw an increase of an average of 10 more patients per day countywide. The graph in the upper right-hand corner, or I'm sorry, the graph in the lower left-hand corner is a 2-week linear regression. On average, about 22% of all of our ICU beds countywide are currently occupied by COVID patients. Our county ventilator utilization, as Dr. Alonso pointed out, remains at about 38%. Daily med alerts, again, fire rescue is transporting more patients. We see just about 18 patients per day. That continues to be slightly increasing overall. Emergency department visits with CLI or COVID-like illnesses, again, that closely parallels our infection rates. In mid-July, our ED visits peaked at 1,090 cases per week. For the week of January 9th of 2021, we saw the ED visits with CLI increase to 663 cases per week. This is a 53% increase since my last physical presentation to you on December 15th. Testing sites, again, we continue our aggressive testing. We have tested over 633,000 people, which is over 42% of the total county population. We have over 120 sites throughout the county. Just as a point of information, there was concern about the Boca Town Center Mall site being closed. That site will remain open for the time being. In closing, our last month's presentation showed that we had 5 red areas. Last week's report was up to 7, and this week we see 6 areas of deficiency. The trends we are seeing include our overall positivity rate continues to climb, our daily lab positivity rate as well, our hospitalization and ICU rates continue to increase, and our death rate has increased along with our ED visits with CLI. I realize that our community continues to have COVID fatigue. So I, again, along with the 3 C's, I want to introduce the 3 W's, that is wear a mask, wash your hands, watch your distance, and by the way, don't touch your face. I do want to talk just briefly about vaccines, just a few more words. In addition to Dr. Alonso's, I want to assure you that the Division of Emergency Management and the Emergency Operation and the county-wide are working closely with Dr. Alonso and her entire team as she rolls out the vaccine into our community. I cannot stress enough that it is a supply and demand situation and that we are receiving very limited supply and that patience is essential. We have twice daily multi-agency leadership calls. We have daily calls with the State Emergency Operations Center. And I personally have frequent calls with Jared Moskowitz, the Director of Florida Division of Emergency Management, to discuss our county's vaccination rollout. He and I are unified in our mission, which is to get as many shots in arms as quickly as the supply of vaccine allows us. I work hard to convince Director Moskowitz of our tremendous need for vaccine, as well as our significant capability to administer it using a variety of modalities to the diverse populations in Palm Beach County in order to optimize our allotment of vaccine. He has given me assurances that second doses will be available. He refers to additional production nationwide, as well as additional agencies and companies, pharmaceutical companies out there that are working on approvals as well. My efforts, his efforts, Dr. Alonso's efforts have been effective, as Dr. Alonso pointed out. We have vaccinated over 42,000 people. We are 3rd in the state, in spite of the fact that we were not one of the Pfizer 5, as Commissioner Weiss pointed out. Again, in conclusion, again, the only thing that we can do at this time, besides being extremely patient, is maintain our 3 C's and our 3 W's. I thank you very much for your patience.
Very good. Thank you, Mr. Johnson. We'll take now a question from Commissioner McKinley.
Thank you. And Bill, there's a significance to this meeting today, correct?
There was a little bit of significance, except I did a little bit of bad math. This was going to be my last meeting because I'm retiring in early February, but I miscalculated. My final meeting will actually be January 26th, or January 26th will be a workshop.
Okay, well, we'll wait to then to give you a standing ovation. I have 3 questions. 2 of them are for you. The first one in regards to the testing sites. When the original CARES Act funding dried up, we ran out of money, or the Village of Wellington ran out of money to be able to continue their testing site. Are we looking at working with them to try to assist them in reopening that?
We have been working with our municipalities. I will work with administration to discuss that. We have been working with municipalities in helping them look at various ways of finding funds. The FEMA funding, the public assistance funding, is available to continue COVID-related activities, which, as you well know, is 75% covered by the federal government, 12.5% covered by the state, and 12.5% covered by the applicant. So there is still funding available for COVID-related expenses, so we can be working with them through that process.
Okay, and the other question I'm getting from the municipalities in my district, how do they go about applying and getting certified to be a point of distribution?
I'll let Dr. Alonso.
There's no certification for that. I think what you're thinking of is how do they get into Florida Shots to be able to be a provider for the shots? Because you need someone, this is different than our pods that we were doing for dispensing, right? Because we need to have the provider that would accept the vaccine and the actual vaccinators. They can be EMTs, they can be paramedics, they can be nurses, so it has to be somebody not just that knows how to give a vaccine, but that actually has given a vaccine in the past so that they're still skilled at giving that vaccine. So what we have to do is to plan and see who wants to do what. And so the message that we're talking to communities that say they want to get ready is they're planning and they're trying to find all those pieces that they need, the space, the staff, and everybody to be able to give those vaccinations out, to be able to do that.
Is there someone on your team that I could direct? It's the Village of Royal Palm Beach that asked yesterday. Who on your team can I connect them with to help them get through that checklist?
Our Shamala Luxman would be the person. Why don't you give me their number and I'll hook them up. Let's do it that way. I think it'll be easier than trying to. So give me the name of the person there, and I'll send me an email, and I'll email it to both you and them.
Okay, thank you. I'll do that today. And Mayor, if it's okay with you, in relation to the daily med alerts, I wouldn't mind asking the fire chief a question,
Of course.
since he's
Chief Duran?
standing in the room. Always going to look out for our first responders, Chief. Seeing the those high number of daily med alert calls that your men and women are making, how is your staffing going, and what sort of reinfection rates are you seeing among your firefighter paramedics?
Well, much as a reflection of the community, we are seeing increases as there's more people in the public that are infected by this deadly virus. We have similar challenges. But thus far, we still continue to answer every call. We're still, clearing calls through dispatch. We're still doing, more assessments upon arrival. We're wearing the proper PPE, and equipment is no longer an issue for us. So we're continuing to ride the storm out and be here and do everything we can for the citizens of Palm Beach County.
Are you seeing a reinfection rate among your firefighter paramedics?
We have had a few that were reinfected. I don't see that as a large number. We're seeing just more people becoming infected. We're seeing the same spike that we saw in the community after the holidays and those events where there's a number of gatherings that have occurred. So again, we have more exposures because, as Mr. Johnson illustrated, there's more positive individuals in our community. So we are seeing some challenges in that area. But we continue to work with local hospitals to make sure our firefighters receive all the appropriate treatment, and they continue to serve admirably.
Well, I think I can speak safely on behalf of this board. If there's anything that you need, we'll support those requests, so please let us know sooner rather than later.
Well, thank you very much. I think the board has demonstrated that ability to help fire rescue continue to perform, all the attributes they need to keep the community as safe as possible, and we thank you for that.
Thanks.
Very good. Thank you, Commissioner McKinley. Commissioner Marino, you're recognized.
Chief, before you leave, one quick question. I know that Mayor Kerner and I did a tour of the facility that you had set up to inoculate your first responders, and I was just curious to know how many of them actually took advantage of that.
We've seen several hundred of our firefighters participate. It's still an open, closed pod, so we still have individuals still coming in and participate. We'd like to see greater numbers, and we're continuing to educate and get everyone in a more comfortable position, but we've seen hundreds of our firefighters participate in that.
Thank you.
We're looking forward to hopefully the next phase, getting approval to go ahead and vaccinate our sheriff's officer as well, so they can participate with them. Our pod would not have been as successful without their help.
Thank you.
Thank you.
Very good. Thank you, Commissioner Marino. We'll now call on Mr. Patrick Rutter. Does that conclude your comments, Mr. Johnson? I think that we had moved on. Okay, very good. Mr. Rutter, you're recognized, sir, for a very brief update on the COVID education and compliance team. And then from there, we do have one more special presentation from the United Way, and I would like to try to get through at least a couple of the first items that would be pretty quick on the agenda prior to taking a break for lunch, and then we'll return and finish up and then go to matters by the public. Sir, you're recognized.
Mayor, Commissioners, good morning. Very briefly, I will give you an update on what the COVID Education Compliance Team, CECT, has been doing over the past few months. We continue to enforce our mask ordinance, have been doing so through the duration. That obviously is our last piece of, our last tool of enforcement, have been doing that as we have from day one. Not just physically out in the field, we still continue to follow up on phone calls and emails that come in. Certainly we get a number of inquiries that will flow through your offices, et cetera. Follow up on all those, handle those as need be. Then on night visits, as we've been doing all along, we will work in different geographic areas, a lot of weekend nights, late weekday nights, et cetera. Try and stagger times, later, earlier, et cetera. So we've been out and about and continue to do so. Main point of emphasis is sharing the importance of what we have with the mask, sharing that with these business owners, with the managers, with the staff there, letting them know just how important it is, and that initial point of contact walking into any business, and letting them know. So on a restaurant end, whether it's a bouncer or just the person greeting up front, sharing that importance, letting them know what level of effectiveness they can have, hitting that requirement right up front and sharing the points. We spent a lot of time conducting education, certainly when a number of the other emergency orders were released. There was a feeling out there in the world that there were no requirements. In the mask one, we've visited a bunch of them. Oh, there are no requirements anymore. And we continually point out that the mask mandate still exists. So there are misconceptions. There still continue to be some misconceptions with some. We will push back. We will address that. We continue to make those points. And then as necessary, we issue warnings or follow through. We really hope, and we've done pretty well with business owners. I think Bill said it earlier, the fatigue factor, we understand it, but it doesn't, we're not there yet. We have a requirement, we have an obligation, and we'll continue to do so. There are no restrictions on operations. This is just wearing a mask. And we will continue to do that, understand their points, but we're working very hard at trying to share every bit of information and share messages we hear from other locations, be it a restaurant or other businesses, hear what other people are doing, trying to push that. So continue to do so, continue to be out there, and we will be enforcing this and sharing that information, and we will be out at nights doing the same type of work. So if any questions, be happy to answer them.
Very good. I don't see any questions from members of the board at this time. On behalf of the board, we thank you, Mr. Rutter, and the other supervisors of the team and the multi-jurisdictions that are involved in this important collaboration. That'll conclude agenda item 4B, COVID-19 update. We'll move now back to 4A, United Way.
Good morning, everyone.
Good morning.
Great to see you. So I have an opportunity to shine a bright light on something that you all are doing. Today I am here, I'm Lori George, I'm President and CEO of United Way of Palm Beach County, and I have the opportunity to present you for the 4th year in a row with the Florida Public Sector Giving Award for the employee campaign. This would not happen but for the leadership of you, Virginia Baker. And I had to pause and think about each year I have the opportunity to come out here and reflect. And, I really thought deep about it. I thought, what is it that is our secret power? What is it that makes it so special? And I love the quote by Dr. Martin Luther King Jr., which is this: life's most persistent and urgent question is, what are you doing for others? And every time you stand up and you speak about giving back to the community, you say, those of us that have should give. those of us that have a job, a roof over our head, and food should give. And because of your consistent leadership, you've really inspired this incredible team behind me to step up and take the mantle and carry it and continue to break record after record. And so I just want to thank you on behalf of United Way of Palm Beach County. Archie Satchel, Stephanie have given in this leadership role to inspire everybody across the county to give. You set another record, giving over $767,000. Over half your employees donated and stepped up because of this cause. And because of the generous contributions, we're able to continue to help 1 in 5 residents access the basics. We could not do this without you. In addition to the employee campaign, you continue to entrust us at a time of a pandemic. You entrusted us with $4 million of CARES funding that we were able to distribute out before the end of the year to get really deep into the community, to touch grassroots organizations that were new to us. And we were so pleased to have that opportunity to do that. So with this, thank you so much for your continued support, and have a blessed day.
Wonderful. Don't go too far. Do you have any other staff members from United Way that you'd like to introduce, please?
Hi, yes, I'm Melissa Wise. I'm the AFL-CIO Labor Liaison with United Way of Palm Beach County, and I was in charge of helping Archie and Stephanie with the campaign. So thank you guys very much. You guys are a really fun group to work with, and you guys do so much to give back to the community. We really appreciate it.
Very good, and I'll recognize the county administrator now for some meaningful comments.
I'll be very brief. It's not the county administrator, it is the awesome staff that I have work with me every single day. And last year was a special year because everybody was going through some very difficult challenges. And I'm going to keep it together, but I could not be more proud of our 6,000 plus, 6,700 plus employees that stepped up to the plate and they gave. If they could not physically give individually, they participated in virtual activities. This group I got is very creative, but they came up with very creative activities that people could still purchase where we would normally do it in person. We did it, through the computer systems, et cetera. I just can't say enough. And Archie and Stephanie, thank you for this year. You've set the bar even higher for the next group to take over, and that'll be Stephanie. We normally have our chair, which is Archie, and then the next person that's going to take over, work with them so they get a very good feel of what's required. This is not an easy task, but the mere fact that our employees are true public servants, and they believe in making sure that our community is taken care of. Lori, I cannot say enough about United Way. When I called you to say, I need help, we need to distribute this money to the right people, you guys stepped up, and you stepped up in a big way to help us get that money out to the people that needed it in a very short period of time. So thank you. I look forward to our continued relationship. And the board, I can't say enough about you because you also give leadership. You're always speaking up for our public, and I think our employees see that. You're dedicated, and you also support our employees. So I cannot thank you enough for your leadership as well.
Absolutely, and it's not like Archie and Stephanie's departments haven't been busy either with other duties during the COVID-19 response. So please, we need all the happiness we can get at this point in this chapter of COVID-19, so let's give them a round of applause for all their hard work. All right, at this time, I'd like to open up the public hearings in relation to agenda item 5A1, which relates to purchase of 11 replacement paratransit vehicles from the Florida Transportation Systems, Inc.
Mr. Mayor, I'll do a motion to receive and file proof of publication.
Is there a second?
Second.
Motion by Commissioner Bernard and second by Vice Mayor Weinroth on proof of publication. All in favor, all opposed. That passes 7-0. Thank you for that, Commissioner Bernard.
Mr. Mayor, I see our director of Palmtran is here. With the board's permission, I'm going to move the recommendation on 5A1 for the authorization and signing of a submission for a grant to purchase 11 paratransit vehicles. The contract is for $1,199,741. The county would match 10% of that, which would be $133,305.
Very good. The motion's been made by Vice Mayor Weinroth on agenda item 5A1. Commissioner Weiss, you recognize, sir.
Thank you. I'll go ahead and second that. And I just had one brief question, and this has come in from the public, and that is, you know, in looking at the paratransit vehicles, they tend to be very tall, and they don't fit under some of the portages. And can you just let the public know why the vehicles are the way they are?
Sure, Commissioner, through the mayor and all commissioners, Happy New Year. Clinton Forbes, the Executive Director of Palmtran. Great question. The Palmtran has 291 vehicles. 90% of those vehicles are what we call cutaways, which are basically a bus body on a truck chassis. And it's a standard in the paratransit industry for ease of use for those who use mobility devices and those who have dexterity issues with accessing the vehicle. So out of more than 300 locations, we have identified 20 that have clearance issues, and we note that in the driver's manifest. And we also have, in terms of our composition of our fleet, we have smaller vans. We call them Toyota Siennas. That's about 10% of our fleet. Those are ambulatory vehicles. They do not have wheelchair. They're not wheelchair equipped. But the taller vehicles, which are the cutaway vehicles, are required for wheelchair access. They're about in height about 10 feet, which clears most entrances and overhangs. But there are some older developments that are lower, and we have noted those on the manifest. They're about 20. And so those drivers, when they get that trip, they know to not go under their overhang, and they park outside and pick up the trip. Also, with wheelchair access, the driver actually assists the customer on the lift and help position that customer on the vehicle, which requires additional headspace. So those vehicles are necessary to provide, our service.
Thanks. Thank you for the explanation.
Very good. Commissioner Marino, you're recognized.
Thank you. Just wanted to share something that I learned yesterday at my agenda review. Would you please all share with us what you do when you are disposing of vehicles that are no longer in the use of the county?
Right. So we are in the process of replacing many of our paratransit vehicles. The vast majority of those vehicles are auctioned through the county's auction process. There is a process under county administration where donations can be made to nonprofit organizations. Mr. Von Laren and I are working on a process to formalize a process because there are a number of vehicles that are going to be available. And we should have that process done probably in February. But there is a current process for donation of vehicles if they meet if they're under a certain threshold of the value of the vehicle.
Thank you.
Thank you, Commissioner Marino. Vice Mayor Weinroth.
And Mr. Forbes, just to reiterate what I had told Mr. Von Laren yesterday during agenda review, I'd like to see priority given to situations where first mile, last mile is the objective of an organization that is seeking one of these vehicles. They're 5 years old. Obviously, they still have more use to them. And if we can do anything to augment the fixed route system with these vehicles being handled by another entity, I'd like to see them given priority.
Yeah, the F-250 Super Strokes run forever. I know that.
And thank you, Vice Mayor Weinroth. That's right on with what we have been talking about and prioritizing some of those organizations on how they'll be able to enhance our current system that we have and how we can work on some of that first and last mile with those organizations. So appreciate your having your finger on the pulse of that for us. Thank you.
Very good. Well, that concludes questions and comments by members of the board. There's no public comment on this public hearing. The motion has been made by Vice Mayor Weinroth and seconded by Commissioner Weiss on agenda item 5A1. All in favor? All opposed? That item passes 7-0. Thank you, Mr. Forbes, for your comments here today.
Thank you.
Mr. Von Laren. We'll move now to agenda item 5B1, Public Safety, which pertains to a Special Secondary Service, COPCN. Would any member of the board like a presentation on this item?
Mr. Mayor, I'm going to move forward on 5B1, which is going to be to approve the issuance of a secondary service certificate of public convenience and necessity to Universal Protection Services for the gated community of Wycliffe Golf and Country Club Homeowners Association, which is in District 6, not District 1.
I'll second that motion in my district.
Agenda item 5B1 has been moved by the Vice Mayor and seconded by Commissioner McKinley. There's no public comment or further discussion by members of the board. All in favor? All opposed? That item passes 7-0. We'll move now to agenda item 5C1, Office of Equal Opportunity, pertaining to an ordinance amending the Palm Beach County Equal Employment Ordinance.
Mr. Mayor, I'd like to move forward 5C1, which be provide for the amending of the definition of employer provided, providing for repeal of laws in conflict, providing for savings clause, providing for severability, and changing the ordinance to include employers of 5 individuals rather than the current 15.
Very good. The motion has been made on 5C1 by Vice Mayor Weinroth and seconded by Commissioner Weiss. There's no public comment at this time, but I'll recognize Commissioner Weiss for comments on this important effort of his.
I just want to say again, how much I appreciate staff helping bring this item forward and the research and so forth and outreach that was done. It's important to note that there was no opposition on this item, that this community has stood fast or stands fast in making sure that we protect the rights of all of our citizens in Palm Beach County and not to be discriminated against regardless of their gender identity, religion, race, creed, whatever. I mean, it is, and we're just making a further statement of where we stand as a county. So I really appreciate it. And with that, I would like to go ahead and, well, I already seconded it, so thank you.
Very good. Yes, the motion's been made and seconded. All in favor? All opposed? That item passes 7-0. Thank you, Commissioner Weiss, for your continued leadership. And to the Office of Equal Opportunity, thank you particularly for handling this so quickly, but also for reaching out to the smaller businesses that would be encompassed by this new ordinance to help facilitate agreement. We'll close the public hearings and move now to the regular agenda, 6A1, Airports, pertaining to a contract with Alevon Pacific Aviation.
Mr. Mayor, with your permission, I'm going to move forward 6A1 to approve a contract for Air Services Development Consulting Services contract with Alevon Pacific Aviation Consulting, professional and technical consulting services as needed basis in support of the Air Services Development Program for PBI, and that contract would not to exceed $200,000 per contract year with an initial 3-year term.
Is there a second? Motion's been made on agenda item 6A1 by Vice Mayor Weinroth and seconded by Commissioner Weiss. No public comment. All in favor? All opposed? 6A1 passes 7-0. We'll move now, still under airports, to agenda item 6A2, an amendment to an agreement with Host International.
Mr. Mayor, with your permission, I'm going to move forward the 6A2, the 13th Amendment to the lease and concession agreement with Host International, total abatement being $947,602, and authorizing the county to terminate Host's right to use concession areas during the term of the agreement without reimbursement of Host unamortized capital investment in the leasehold improvements.
Agenda item 6A2 has been moved forward by Vice Mayor Weinroth and seconded by Commissioner Weiss. It's my understanding, in short, that this is accommodation for COVID-19 related impacts. We appreciate Ms. Beebe's proactive efforts to make sure our economic abilities at the airports remain vibrant. I don't see any questions from members of the board, so we'll go ahead and vote. All in favor? All opposed? Agenda item 6A2 passes 7-0. That concludes airports. Thank you for your time today. We'll move now to agenda item 6B1, Parks and Recreation, regarding a resolution authorizing a lease of real property to the YMCA in Lake Lytle Park. Whatever you want, you're recognized, sir.
Yeah, thank you. I'd like to go ahead and move item 6B1, A and B. This is a lease and a resolution authorizing the lease of property to the YMCA. This agreement has been under discussion and work by staff for many years. I understand it originated with Commissioner Coons, and it's taken a little while to get this done, but it's coming to fruition today, and so I want to go ahead and move this forward.
Very good. From a procedural standpoint, just to clarify, Commissioner Weiss, you moved agenda item 6B1 forward.
6B1, A and B.
Second.
Very good, and that second's been made by Vice Mayor Weinroth. We do have public comment. Before we move into public comment, I'd like to take comments by commissioners. So Commissioner McKinley, you're recognized, or would you like to wait?
I'll wait.
Very good. Then before public comment, I'd like a very brief presentation on what we're facilitating here, because it is quite an impactful project, but please keep it concise.
Okay. Good morning, Commissioner, and thank you so very much. So I'm Dort Miller, and at the table we have the Director of Parks and Rec, Eric Call, Bob Hamilton, and also our attorney, Howard Falcon. So as you mentioned, this has been in the pipeline for about 2018, where we got direction from the board to enter into negotiation with the YWCA to co-locate their operations to Lake Lytle Park. And we are pleased to present the conceptual site plan as well as the term of the lease agreement. And I will turn it over to Eric for this presentation.
Good morning.
Yeah.
Good morning.
Again.
Can you hear me now? There we
Good
go.
afternoon, actually.
Okay.
After all
Mayor,
that.
Vice Mayor, Commissioners, good morning and Happy New Year. This is a project we've been working on for quite a while. As Dorit mentioned, it started back in 2018. We were authorized by the board to move forward and look for an opportunity here. Since that time, we worked collaboratively with the executives at the YMCA and come up with a really, really good program. Each party will construct their respective improvements at their own expense. The county will construct an aquatic center through infrastructure sales tax funds. The Y will construct their facility in 3 phases, the first in 3 years, the second phase within 6 years, and the third within 10 years. Lease allocates just 5 acres of Lake Lytle undeveloped park. The term is for 50 years with a 50-year renewal. And during the design and permitting phases of the joint projects, the YMCA will reimburse the county up to 50% of the infrastructure design cost, not to exceed $75,000. The lease also, importantly, requires the Y to enter into an operations agreement with us, with the county, to assume responsibility for operations and programming of daily maintenance of the aquatic facility within 24 months of completion of construction of the aquatic center. And this potentially could equate to a savings to the county of upwards of $250,000 a year. So that's important. And the Y, of course, is the nation's largest provider of swim lessons and drowning prevention programs, and constructing our aquatic center adjacent to theirs gives us an opportunity to create some synergy and really work effectively with them. Cooperative partnerships like this are not new. They've happened in Miami-Dade County, Broward, Hillsborough County, and elsewhere around the country, and we feel that this is a partnership we can really get behind. Staff strongly supports this partnership, and we recommend that the board approve the resolution and the lease agreement with the Y for 5 acres of land in Lake Lytle Park.
Very good. Thank you, Mr. Cole. And thank you also for your leadership during this pandemic. The way that you've handled the park system and accommodating the needs has been wonderful. We'll move now to public comment, and I'll recognize Commissioner Bernard.
Thank you, Mr. Mayor. The first person will be Tim Cotfield, followed by Mr. Tim Loliette.
Sir, you're recognized for 3 minutes.
Thank you. Yes, my name is Tim Cofield. I'm the YMCA CEO here, the YMCA of the Palm Beaches, where we're for youth development, healthy living, and social responsibility. I just want to say how dedicated we are to this project. We thank the county staff so much for their leadership in this collaboration under Parks and Recreation Director Eric Hall, working with Bob Hamilton, Director of Parks Development, and many departments. And I can tell you this was an extremely collaborative process. We have great plans for this collaborative that will serve the residents of the Palm Beach County in this very densely populated area. And we look forward to the opportunity, and we're 100% behind it. And I'll introduce our board director, Tim Luliet, who can tell you about the support we have of the board and the community. Thank you.
Very good, and thank you for your commitment to our community through the YMCA.
Thank you.
I learned to skateboard there. I busted many body parts during that time period.
I am Tim Luliet, Chairman of the Board of the YMCA of the Palm Beaches, and I just want to pass on to all of you the full and unqualified support of the Board of Directors of the YMCA for this project. Understand that the YMCA around the country is building now about 40 new Ys a year, unprecedented growth for the Y. So we have a great way to benchmark not only the facility and the construction process, but also the programming for our community. We've been part of the Palm Beach community for over 100 years. This is the next step of our growth plan, and we appreciate all your support. Thank you.
Awesome, very good. Thank you for those comments. And Vice Mayor Weinroth will now lead us in a rendition of YMCA. Commissioner McKinley, you're recognized, ma'am.
Thank you. Excited to see this project move forward. I was telling staff yesterday, Sarasota County did a similar partnership with the YMCA there, and it's proved to be very, very successful. But my question is, we've been talking just as long about this park as an ATV park at 20 Mile Bend. And I think that conversation was initiated about the same time Coons initiated this conversation, and I keep getting excuses of why we can't do it. The original requests and some of the concerns were coming from the acreage community, a large number of ATV riders in that community, and as it got developed, the folks that enjoy that activity were going onto private property and other locations that weren't safe. That was, at the time, the only source of concerns and complaints that I received. I now have received a call from the mayor of Belglade that they are starting to see that problem pop up out in the Glades community. And I can't think of anything more dangerous than the potential of a farm tractor colliding with an ATV vehicle or something happening on farmland. So I would like to ask again that staff look at trying to find a creative way, much like we've been able to do with Lake Lytle. There's got to be some sort of ATV park developer out there that could do something similar, and if we could look at that, because I think we're probably a bit of a ways off in terms of even discussing a bond referendum. I don't think now is the time to do that. But if there are other creative ways we can make this happen, I'd like to ask that you do that.
Be glad to do that.
Thank you.
Thank you, and we look forward to you getting back to Commissioner McKinley. Commissioner Sachs, you're recognized, ma'am.
Thank you so much. And I really honor the organization that you represent, and I applaud all of you for all the work you've done on it. I want to re-echo what Commissioner McKinley said, because so many times, and I've worked with youth in my business, and the YMCA is really a parachute for so many of our youth today. And I can imagine that out in agricultural areas that they need that structure so as well. So I'm going to re-echo what Commissioner McKinley spoke about. But let me ask you a question. The YWCA is active in Miami. Do we have it's very active in Miami, and it's very popular. Does your organization also encompass the YWCA here in Palm Beach County?
It's a separate organization.
I have to defer to the YMCA executives.
Yes, thank you. We are, as you know, wholly separate organizations. There is a YWCA here. I think they're headquartered in West Palm Beach, but we are not affiliated with the YWCA. And they have taken on a mission of, a select mission looking at homelessness, helping young parents, young mothers that are struggling through pregnancy issues and other things. And they have a select focus here, but we do look for opportunities to collaborate. And I know many municipalities do collaborate with the MCA, with the YWCA, and we will continue to look for opportunities here in Palm Beach County.
May I, Mr. Mayor?
Of course.
Girls skateboard, and girls also drive ATVs. I would like to see, and I'm just, I didn't want to catch you off guard here, but we need to offer the same facility to the girls at the YWCA.
But I want to assure you, Commissioner, there are 50% females in the YMCA. It is not a male-only organization. We have children and families, all factions of religious groups, and we are 50%. We have female programs, and we have as many female skaters at our skate park as we do males.
Can we speak later to
Certainly.
to the CEO about what we can do as an outreach between the YMCA and the YWCA
Certainly.
here in Palm Beach County? Because I want to be sure that even though I know there's a little bit like the Boy Scouts today, maybe, that the girls are in the Boy Scouts, but I want to be sure that the girls who are a part of the YWCA here in Palm Beach County have an outreach invitation to them to know that their membership in the YW will also give them an opportunity to use all the facilities available to the YMCA.
We would look forward to that. And with the skateboarding, the first time in the 2020, which is now the 2021 Olympics, I can tell you that 40% of the Olympic skateboard team is made up of females.
And maybe one of them will come from Palm Beach County.
Yes, there's
So
actually...
I look forward, they say run like a girl.
Right.
The gals are great, and I just want to be sure that even though Vice Mayor Weinroth can do the YMCA rendition pretty well, I bet we three ladies could do the YWCA just as well. So I look forward to working with you,
Thank
sir,
you.
on that. And
Appreciate
thank you.
that.
And I've had the pleasure of seeing Commissioner Sachs, then Senator Sachs, fight like a girl in the legislature for her constituents. All right, very good. The motion, that concludes public comment and comments by members of the board. The motion on 6B1 was made by Commissioner Weiss and seconded by Vice Mayor Weinroth. All in favor? All opposed? That item passes 7-0. Thank you again. We'll move now to facilities and operations, 6C1. Madam Administrator, how long did you anticipate on this item?
I think maybe 15, 20 minutes, and that'll depend on the questions that the board has.
Let me just take the pulse of the board. You want to keep going? All right, come on forward, please. We're now on 6B1, and then we'll just, I think the rest of the agenda will take less than 5 minutes from there. And then we can just have matters by the public. You are recognized, ma'am.
Good morning, Mayor, Vice Mayor, and Commissioners. Isami Ayala, Director of Facilities Development and Operations. With me today is Eric McClellan, Director of Facilities, FDO Strategic Planning, James Green, Director of Community Services, and Michael Johns, Assistant County Attorney. We would like to provide the board a brief overview of the Cottage Homes Developer and Operator Agreement that is being brought forward today with much anticipation, and a staff recommendation for approval. Given his involvement in the planning of this project, as well as his participation on the selection committee that reviewed the proposal received, no one better than Eric to provide you a brief review of the historic evolution of this project.
Thank you, Ismi. Check. Thank you, Ismi. Good afternoon, Mayor, Vice Mayor, Commissioners, and staff, and a very happy new year to each of you. I'm going to go off script a little bit, try to abbreviate some of the presentation points, and for those of you who have sat before me before, I'm sure that'll be surprising and very much appreciated. Twice this project has been before this board, 2 different occasions, with support in each instance. The Cottage Homes project is one of 4 sequential steps in use of the entire $25.5 million in the infrastructure sales tax, or IST, project plan for affordable housing initiatives. Direction was given at the last time this was before the board to issue an RFP to all local housing authorities to convey ownership of the property and to provide up to $3.973 million in IST funding for development of the project. The county-owned property that will serve as the project site is comprised of 2 parcels that combine to approximately 1.36 acres. The property on the north side of Clemens Street was acquired by the county in 1987 at a cost of $203,000, and the property on the south side acquired in 1984 at a cost of $360,000. No appraisal has been obtained, and one is not required by policy for an intergovernmental transaction, but we have previously represented an anticipated appraised value of somewhere between $600,000 and $900,000. The site formerly housed the Lake Worth branch of the tax collector's facilities. Initially, staff intended to repurpose that previous building for use by PBSO. However, upon performance of due diligence, the cost of repurposing that building simply exceeded what we felt was reasonable given the size and age of the structure. The due diligence did discover that the underlying plat of the property continued to support 21 individual residential lots. And with that, in addition to some other considerations, that led to staff recommending and the board approving demolition of that former building and proceeding forward with a Cottage Homes pilot project. The RFP itself was issued in December of 2019, and with knowledge that there was a waiting list for housing in our community, as well as the ability to seamlessly transition from development into operations, the decision was made to solicit the development opportunity to housing authorities. And some of the key conditions of the RFP include the county providing the IST funding in the amount of $3.973 million, conveying its interest in the 1.36 acres upon receipt of all permits, and again abiding by the underlying plat of the property. Due to restrictions for use of IST dollars, ownership must remain with a governmental entity, and for that reason the project would be operated in a rental-only format. The population to be served is those earning less than 80% of the area median income, or AMI, and the housing authority is to develop, construct, operate, and maintain the project, with the authority's direct expenses being considered excluded costs for their staffing and personnel. Several local housing authorities did express early interest and participated with us during outreach and development of the RFP, but ultimately only the West Palm Beach Housing Authority submitted a proposal. And the authority proposes to develop 17 detached housing structures, a community center, ancillary parking facilities, and other typical site improvements. The 17 units would be distributed amongst 3 different layouts, 6 2-bedroom, 1-bath units, 6 2-bedroom, 2-bath units, and 5 3-bedroom, 2-bath units. Square footages ranging from 981 to 1,200 square feet. Maximum gross monthly rent would initially be $598 to $730, and the maximum continued occupancy for any unit would be 24 consecutive months. Based upon the review of the proposal, it does conform to the plat, and it was also favorably reviewed by the selection committee. There was only one exception that was noted based upon the requirements of the RFP, and that was the inclusion of a proposed developer's fee by the authority. During the evaluation process, the selection committee did bring this finding to the authority's attention and indicated that further consideration would be given during the contract negotiation process. Again, the proposal has been unanimously endorsed by the selection committee. We thank the authority for their interest and the quality of their response, and staff does recommend approval of the agreement between the county and the authority. So with that, I'm going to turn it back to Isami to address terms of the developer and operator agreement.
Thank you, Eric. Please note that for sake of brevity, I will only highlight at this time the most relevant terms of the agreement. A more comprehensive summary is included as attachment 2 of the agenda item submitted for your consideration, along with the entirety of the agreement as attachment 3. Under the proposed developer and operator agreement, the Housing Authority will be responsible for the development, construction, ownership, operation, and maintenance of the project. The county will provide ISD funding in the amount of $3.9 million and convey its interest on the 1.36 acres property. It must be noted that conveyance will not occur until the authority obtains all permits and approvals required for construction. The recommendation for conveyance will be, at set time, brought as a separate item for consideration of the board. However, it must be noted at this time that that eventual intergovernmental conveyance will be at no charge, subject to restriction to government use, operation, and maintenance for housing of low, very low, and extremely low income residents, and will not require review by the Property Review Committee. Eligible expenses consist of all design, permitting, and construction services, including consultant fees, application fees, labor, and materials. Excluded costs include the authority's employees, attorneys, financial advisors, financing, promotional items, and contractual termination damages. The 7% developer fee included by the authority in its proposal was reduced to 3%. The difference will be allocated to program contingency. The authority is licensed under Florida statutes to perform construction. The program estimate includes a 14% contractor's fee. The authority will be solely responsible for any and all cost overruns. At the completion of the project, any remaining funds in program contingency will be transferred to a county-maintained initial renewal replacement fund. The authority will be required to obtain county's approval of all drawings and specifications. The authority is to obtain all required permits by September 13, 2021. Per the proposal, construction is expected to take about 400 days, which will result in the facility operating or opening in early fiscal year 2023. It must be noted that it is possible that the project development timeline will need to be revisited to incorporate any additional requirements resulting from the permitting process. The authority will be responsible for repair, maintenance, operation, and security. The authority will retain all revenue collected from the operation of the project. Placement priority will be given to low, very low, and extremely low income households and waiting lists maintained by the county through its Community Services Department. Rent shall not exceed 30% of the tenant's gross median income. Tenants shall not earn more than 80% of the area median income for the county. Occupancy of each unit will be limited to 24 months for any given tenant. The county will provide wraparound services, which include but are not limited to case management services, security depositing, rent subsidies, and utility subsidies. The additional costs are to be budgeted within the general fund under the Community Services Department. The agreement will provide for an initial term of 34 years with 2 renewal options of 30 years each. There are several scenarios under which the agreement could be terminated as a result of the default of either party. In all but one, the property returned to the county's ownership for continued development and or operation. The only exception is if the county were to default as a result of failing to refer any low, very low, or extremely low income households for placement in an available unit for a period of more than a year, in which case the authority can retain ownership of the facility. All that proceeds taken into account, staff is recommending to the board approval of a developer and operator agreement with the West Palm Beach Housing Authority for the development, ownership, and operation of a small lot housing project upon the 1.36 acres of county-owned real property fronting Military Trail in Clement Street in western Lake Worth Beach. Before the board proceeds with consideration of the item, I would like to turn the presentation to James, who will provide the board with an overview of the services typically offered to the target population to be served by the Cottage Homes project.
All right. Good afternoon, Mayor, County Commissioners. So I just want to begin by giving an overview of how clients will be receiving these services. So if we could go to the next slide very quickly. So essentially, they can either call in or our homeless outreach team members will reach out to them. They can call in to the number 904-7900 or 355-4792. We have our call center representatives there. There they'll be deemed as either families or singles. One of the things that we want to do first is to make sure that we are trying to reunify them with families. So diversion is a researched method that has worked throughout the country. It's a best practice. We know that over half of the families are just having issues with their family members and then they're being kicked out. So if we can reunify them and make sure that that situation is resolved, then we can keep them stably housed. If, for whatever reason, we can't, and we'll look at those individuals who are on the street, we'll complete a VI-SPDAT. It's a vulnerability index. It's a prioritization tool that allows us to see what the needs of the families are. And based on their needs, they'll either be placed in emergency shelter, rapid rehousing, where we'll subsidize their rent incrementally, decreasing those subsidies, or the cottage homes, which is, this is an option for them where they'll be able to stay for up to 24 months. So I just want to share some information about some of the services that they'll receive once they are in the cottage homes. One of the things that we want to make sure we focus on is helping them to gain employment. We want them to earn more. They'll pay 30% of their income, and as they earn more money, that money will go into an escrow, because the whole goal is to make sure that when they're ready to transition out, they have funds to be able to transition into stable housing. So we'll work with them on financial literacy. We'll work with them on other subsidies, helping them to, earn income tax credits, whatever they need in order to be stably housed and ready for that transition. We'll work with our other system partners to provide mental health and behavioral health services. We'll work with our school district and youth services department and others to make sure that those needs are being met. And we want to make sure that we're partnering with Habitat for Humanity, Community Land Trust, some of the other affordable housing complexes to create options for these families that are ready for transition. So as we continue, again, the cost for this program is going to be around $309,000, and that would include staffing and some of the subsidies. Some of the outcomes that we're looking for are around permanent housing, making sure that they're placed, increasing their family income, and making sure that we're increasing their literacy skills. And for those entities that for whatever reason are struggling, and we want to make sure that we're assessing them on the front end so that they're successful on the back end, we'll use whatever means necessary to make sure that they're housed once they're transitioning out of the program. And I'll pause there for any questions or concerns that you may have.
Very good. Does that conclude the presentation? Very good. Commissioner McKinley recognized, then we'll go to Commissioner Marino.
Yes, thank you. I have been working on this with staff and pushing for this for over 3 years, and it's really exciting to see it come to fruition. This little idea is the result of watching too much HGTV, and seeing what I call tiny homes, which Virginia calls cottage homes. So, Mr. Mayor, if it's okay, I'd like to make the motion to approve a developer and operator agreement with the West Palm Beach Housing Authority for the development, ownership, and operation of a small lot housing project upon 1.36 acres of county-owned real property fronting Military Trail and Clemens Street in western Lake Worth Beach. I'd like to congratulate Commissioner Weiss for getting this wonderful facility into his district. I thank the team for putting together such a phenomenal project, as well as the wraparound services, which are key. It's not just affordable housing that families need, it's sustainable housing, and teaching them how to be able to manage their finances and help them succeed in doing that is key. I think this is phenomenal, and I'd like to thank the West Palm Beach Housing Authority also for responding to the RFP with such a great project.
Very good. Commissioner McKinley has made a motion to move forward agenda item 6C1 with Administrator Baker as a co-sponsor to that motion. Is there a second? Second by Commissioner Weiss. I'll turn now to Commissioner Marino for further comments.
Just a question. Please clarify for me who is paying electric, water, and all of the other utilities and how it's getting done.
part of our subsidies through community services include the payment or the provision of utility subsidies.
So then the county is paying the water and the
On
electric?
those cases that are needed per the qualification process on community services.
Okay, thank you.
But I also would like to add, and correct me if I'm wrong, so as the residents in those units progress, then it's a sliding scale and we start to move them off where we're not paying all of it. Remember, these are homeless people or people about to be put out of place. More than likely, they're not working. We put them into this, and so we want to make them whole, get them back on their feet, and then they start to assume some of the day-to-day kind of responsibilities. So that is how the program works today. We anticipate it continuing to work that way. We do not anticipate all of the residents to stay in these units for 24 months. We want to be able to put them on their feet, get them back into the regular housing market, and then be able to help others in these same units.
Very good. Any further questions or comments, Commissioner Marino? All right. We'll move now to Commissioner Weiss, then Commissioner Sacks.
Thank you. Thanks again for bringing this project forward. It was important, I think, in Commissioner McKinley's, or to provide support for this idea. So I'm pleased to be able to do that. But I have one question, in just more so for the public, in regards to if this were to, the Housing Authority were to stop operating this facility, that this would reconvey back to the county. And just if you can clarify that.
If the Housing Authority were to stop to operate, which will mean a default on the contract, then the property and the balances at the time on the accounts that are in place or will be in place for the operation will revert to the county, and at that point, the county will need to make a decision about how to continue forward.
Okay, thank you very much.
Very good. Commissioner Sacks, you're recognized.
Thank you so much. And I just want to commend the board and especially Commissioner McKinley. This is excellent because this is the only solution to homelessness is a step up. This is a step up. And I want to commend all of you for following through on this. And I want to look forward to visiting this area. You know, we're not the only state that has this issue. And we're really just getting up to speed with the other states in the country that are doing the same thing. And the wraparound services is good. This is like being able to give a hand to those folks and those families that really, really need it. So I want to thank you very much. Thank you for Commissioner McKinley and the others on this board that worked on this before I got on here. And maybe I'll check them out myself. I think it's a great idea. Thank you very much for that. Thank you.
Thank you, Commissioner Sacks. Ismay, James, thank you so much for the great work you guys have done under very difficult circumstances. You guys haven't missed a beat, and we greatly appreciate that. The motion has been made on agenda item, excuse me, 6C1 by Commissioner McKinley. It's been seconded by Commissioner Weiss. There's no further comments. All in favor? All opposed? That item passes 7-0. Thank you very much. We're going to now recess as the Board of County Commissioners and convene as the Child Care Facilities Board for the purposes of agenda item 7A1, which is a nomination of Mark Hospafel.
Mr. Mayor, with your permission, I'm going to move forward the appointment of one member of the Child Care Advisory Council, Mark Holsfeld.
Very good. Is there a second? Motion's been made by Vice Mayor Weinroth, seconded by Commissioner Weiss to seat number 7, Mark Hospafel, to represent Florida Department of Children and Families on the Child Care Advisory Council. No public comment. All in favor? All opposed? That appointment passes 7-0. We'll reconvene as the Board of County Commissioners. I suspect that we're all okay with tabling commissioner comments till after matters by the public, or would we rather do it now? All right, with your permission, we can do board appointments found on page 51 and then take a short recess for lunch prior to returning for the remainder and then matters by the public. All right, board appointments, we'll start to my right with Commissioner McKinley.
Mr. Mayor, I have 3 appointments today. I'd like to move the appointments of Victoria Churis to the Citizens Advisory Committee on Airport Noise, Marcel Griffith Burke to the Zoning Commission, and Ben Morris to the Land Development Regulation Advisory Board.
Very good, the motion's been made by Commissioner McKinley and seconded by Commissioner Marino. No further comment, all in favor, all opposed. Those appointments pass 7-0. Commissioner Marino, you're recognized for appointments.
I'll have some comments when we have commissioner comments later, but at this point in time, I would like to request board approval of the following District 1 appointments. Cherie Pavlik to the Zoning Commission, Dr. Jean Wibby to the Educational Facilities Authority, and Elizabeth Berkowitz to the Advisory Commission on Women.
Second.
Very good, motion's been made by Commissioner Marino. Is there a second? Second by Commissioner McKinley. No further discussion. All in favor, all opposed. Those appointments pass 7-0. We'll now go to my left to Commissioner Sachs for board appointments. No board appointments at this time? No. Very good. Commissioner Weiss, you're recognized for appointments.
Yes, sir. I'd like to appoint James Ned Kerr to the Land Development Regulation Advisory Board, also known as LDRAB.
Second.
Motion by Commissioner Weiss and second by Commissioner Bernard. There's no further discussion. All in favor, all opposed. Those appointments pass 7-0. Commissioner Bernard, you recognized.
Mr. Mayor, I don't have any appointments.
Very good. Vice Mayor Weinroth, you're recognized.
Thank you, Mayor. I'd like to reappoint Jim Knight to the LDRAB.
Motion by
Second.
Vice Mayor Weinroth, seconded by Commissioner Weiss. All in favor, all opposed. That appointment passes 7-0. Board of County Commissioners will be in recess until 2 o'clock for matters by the public. Thank you.